It's time to start. Okay. Good morning, everyone. Welcome to 2022 World TCM and Acupuncture Week. Today is day 6, presentation sessions in English. Our first speaker is Dr. Nie Hui. Let me introduce her background. Dr. Nie Hui is a TCM doctor, PhD of TCM Acupuncture. She is currently the president of the British Alumni Association of Heilongjiang University of Chinese Medicine. She used to be an associated professor of Heilongjiang University of Chinese Medicine, and the deputy director of the Department of Acupuncture and Neurology and of the affiliated hospital. She served as the academic executive of the Association of Traditional Chinese Medicine in the UK for 3 years. Dr. Nie Hui's specialty is scalp acupuncture. She is a master's and doctoral student of Professor Yu Ji-shun, a famous scalp acupuncture expert. During her master's and doctoral studies, she mainly did scalp acupuncture research and is good at treating neurological diseases with scalp acupuncture. Her topic today is scalp acupuncture for Alzheimer's disease. We welcome Dr. Nie Hui.
Ladies and gentlemen, good morning and good afternoon. I am Hui Nie from England. Thank you for hosting. Thank you for organization. Today, I would like to take this platform to share my topic. It's scalp acupuncture treatment for Alzheimer's disease. Alzheimer's disease is quite common in the world nowadays. So I would like to share this topic. Today, my catalog includes 6 parts. 1, symptoms and the cause of Alzheimer's disease. 2, Western treatment for AD. 3, traditional Chinese medicine of AD. Case study of AD. 5th, introduction to 14 lines scalp acupuncture. Last one, I will give you a summary. So firstly, let me introduce what is Alzheimer's disease. So most people, I think, might understand this problem. So mainly that two symptoms, memory loss and cognitive function, that dysfunction. Release diagnosis of Alzheimer's disease are increased as more people live longer than ever before. It's one of several different disorders that old adults may develop, which may affect memory and cognitive function. Although most people have heard of it, many people don't know the definition of Alzheimer's disease or what causes it. Through currently that public that data of the total US population, more than 1 in 9 people age over 65 and old has AD. Alzheimer's disease is one of several diseases of elderly that has recently come into prominence for a number of reasons. So what causes Alzheimer's disease? Currently, we think no reason. We can't know what exactly causes this problem. So I know. According to that public research, roughly, doctors think probably due to age, family history, cardiovascular disease, heart injuries, and also some scientists think due to that diabetic or high blood pressure. Personally speaking, I think mainly due to age or might be family history. Because currently we see lots of people suffer from Alzheimer's disease. It's common in older people. And also that might be due to family history, due to that genetics. So what is the etiology and pathology of Alzheimer's disease? What causes it? So we think that the reason and what is the pathology. So currently, mainly that Alzheimer's disease is thought to be caused by the abnormal buildup of proteins in and around the brain cells. So mainly two bad protein. One is amyloid beta protein, another one tau protein. Amyloid deposits which forms senile plaques around the brain cells. So if the senile plaques around the brain cells affect normal brain cell works, so brain cells lost that communication between each other. So affect people cause the memory loss. And also another bad tau protein that deposits which form neurofibrillary tangles within brain cells. This also affects nerve normally work. So the brain cells lost their job. So cause that the brain cells can't work. That those senile plaques and also that neurofibrillary tangles occupied, deposit normal that the brain cells. Brain cells lost their work. How affect that the two bad protein, how affect the people brain cells? Mainly related to that one chemical is called acetylcholine. A young mind has the capacity to store to the wealth of information. This is made possible by the neurotransmitter acetylcholine, which means and strengthens the neural connection responsible for sharp memory. But as we get old, declining levels of acetylcholine began to weaken and the neural pathways required to retrieve information. Promoting health levels of acetylcholine forges neural connections which power the information sharing network of your mind. This biological process restores retentive memory, clear focus, and confident decision-making. So currently, how about the treatment for Alzheimer's disease from a Western doctor? Mainly currently popular, there are two drugs. There's currently no cure for Alzheimer's disease, but there's medicine available that can temporarily reduce the symptoms. One kind of that medication is called acetylcholine isosteres inhibitors. This medication increases the levels of acetylcholine, this acceptance in the brain that helps nerve cells communicate with each other. Another medication is called memantine. It works by blocking the effect of an excessive amount of a chemical in the brain called glutamate. So much more glutamate is not good for people, so can cause that Alzheimer's disease. So currently, how about Chinese medicine treat that Alzheimer's disease? Current overviews of traditional Chinese medicine for the treatment of Alzheimer's disease. In the past 5 years, there are very few articles on Alzheimer's disease using Chinese medicine and acupuncture in the field TCM. And they are all in the research and exploring stage. So a lot of people that's got the research, a lot of scientists, that's the research that what is mechanism for Alzheimer's disease, what is pathology. For example, Dr. Hu from Hebei University, they research progress of traditional Chinese medicine regulating WNT-based certain signaling pathway in the treatment of Alzheimer's disease. So traditional Chinese medicine that herbs for Alzheimer's disease, now some clear that good that research. That's according to a lot of the papers that they report that build up kidney, those herbs can help Alzheimer's disease, such as that 阴阳货、菟丝子、肉苁蓉, etc. Few articles report the use of scalp acupuncture to improve Alzheimer's disease. Alzheimer's research done by some scientists is basically a lot of laboratory researches. So very few people report treat that Alzheimer's disease by acupuncture or scalp acupuncture. No much more papers. So I would like to introduce 2 cases of scalp acupuncture for Alzheimer's disease. Case A, that the first round of treatment, that patient age 50 when he visited me, 2016, his main symptoms was memory loss, for 2 years, mainly for 2 years, and lost the concentration, poor language fluency, so speak not very fluent. And also, he was not able to do his job, difficulty. That hospital gave him that check. MRI scan showed his that premature production of brain volume cells in the reduction of brain volume cells in the right medial temporal lobe of the brain. So NHS, that hospital, gave his diagnosis, clearly diagnosed is early Alzheimer's disease. I gave him that TCM, that pattern differentiation, is qi deficiency and blood stasis. Deprivation of brain cells. I give his treatment, scalp acupuncture plus body acupuncture. And the total gave him just the total 10 days herbs, because in the beginning, I thought I wanted to give his herb treatment and with that scalp acupuncture, but he didn't like herb treatment. He only chose that scalp, that acupuncture. So only 10 days herbs, he stopped. So the following treatment, only acupuncture. I give his acupuncture mainly international standard 14 lines scalp acupuncture. I choose that the points, MS1, MS3, MS4, MS5, MS8, MS9. So I saw that the points. So that MS1 is called that the middle line of forehead. It's just the points from that 224 shen ting, related shen ting. And also I gave his the MS3. MS3 points is called lateral line 2 of forehead. That related to points GB15 头灵气. And another point on head, I gave his MS4. It's called lateral line 3 of forehead. It's related to the stomach channel 8. 头围. And also I gave his treatment MS8, MS9. MS8, that's it's called the lateral line 1 of vortex. It's related to that point BL6 to BL7. 晨光到通天. And another one, MS9, that called the lateral line 2 of vortex, that relate to 2 points that lie between the point GB17, 成陵, and the GB18. So what is MS? MS1, MS3, MS means that the microsystem acupuncture. So this patient, I give his that this time. So those points, every time I don't choose all that lines. So I choose some lines. So this time I give this lines MS1, MS3, and MS9, and MS5, this treatment. So scalp acupuncture, mainly that important that the manipulation. If you only choose points, you put needles there, you leave it there, can't work successfully. So we need to give that good manipulation. So insert the needles and then need to give manipulation, rapidly twist the needles at per minute 100 and 150 twists. So some people like take 200 twists per minute. I prefer 100 to 150 twists per minute, because when I got my master degree of acupuncture, that time I researched stimulation scalp acupuncture, that my master degree subject. So that I prefer that 100 or 150. That's good stimulation. So during remaining needles for 30 to 40 minutes, we give that 2 to 3 times that manipulation, and each time 1-2 minutes. And also for some cases, I gave the electric acupuncture. This patient, I gave this electric acupuncture because the first 5 sessions not some good result. So later I gave that electric acupuncture. That intensity, that's give up about that second scale is okay. And the body acupuncture, I give this patient in tongue, heart channel 8, 少腹 heart channel 5, 通里, and the liver that channel 3, 太冲. Why give heart channel points? Because according to traditional Chinese medicine theory, the heart and according to the 5 elements and that organs differentiation, heart related to people's spirit. So and related and also very closely related to that brain. So I gave heart that points. So case A, I gave his treatment. After 3 months treatment, that his memory improved. That case A mainly symptoms, memory loss, very serious. Because that time, first visit, during the consultation, I asked him, because that appointment, the morning 10 o'clock, I asked him, what was your breakfast? He couldn't remember what he ate, that food, breakfast, that's 2 hours. So he didn't know. Very bad memory. After 3 months treatment, once a week acupuncture, so memory improved. 7 months later, he went to hospital, get a review his condition. And that hospital doctor gave his MSSE, mini mental state examination. 这是一个量表. So give his that review before his review 86. And this time, after 7th my acupuncture treatment, he got 94 because he haven't got any Western medication treatment, only to acupuncture. So he got very good improvement. And that hospital doctor gave his that order, so don't need to come back re-examination. Since then, I still give his that treatment for consolidation. So total first round treatment 10 months. And after first round treatment 10 months later, and then break 21 months. 20 months no treatment, and then he came back to see me. So 2016 November, he came back, and this time 2019 June. So he complained he's had a bit memory loss and no good mood, but no serious than before. So this time I gave his only 10 treatments, acupuncture, memory come back normal. But this time I gave his advice, he needed to continue treatment acupuncture for consolidation. So he followed me. Total this time get the 27th acupuncture treatment, but not every week, 1 week in 2 weeks treatment. So far, since last year, 2021, last year, he stopped treatment. So far, he didn't come back. So let us see that case A treatment line from acupuncture, mainly scalp acupuncture. So 10 months treatment acupuncture, but the concentration treatment only first 3 months, and then 20 months no acupuncture. And his symptoms come back a little and give another 26 months treatment, but only 10 months concentrated treatment once a week, and then treatment only once in 2 weeks, once in 3 weeks. So far, he didn't come back. So what is the analysis of case A? Case A very clearly Alzheimer's disease. So I gave his treatment. I think scalp acupuncture can effectively stimulate the cholinergic neurons 胆碱能显微 in the cerebral cortex 大脑皮层 to release more acetylcholine 乙型胆碱 transmitters, thereby rapidly improve a series of symptoms such as dementia, and at the same time reduce excessive formation of amyloid and tau protein in the brain, which also prevents the further deterioration of the condition. 恶化. So let me introduce case B. Case B treatment, that's this patient, 75. He still get clearly Alzheimer's disease. He suffered this problem 5 years, but he visited me first time, not for this Alzheimer's disease problem. He just want to pain relief for his sciatic. But during consultation, I got the information he suffered Alzheimer's disease. So in the same time, I gave his two sets of acupuncture treatment, one for sciatica, another one for Alzheimer's disease. I gave the scalp acupuncture. After 5 sessions, pain has gone, and his memory a bit better because he got the Alzheimer's disease is middle age. Alzheimer's disease divided 3 stages. In the beginning, first stage, middle stage, and the last stage. Normally, last stage need to look after this patient. But this patient, the middle stage, first visit, he can't smile, he can't look after himself, or his wife look after this patient, and also he didn't speak. Look like a sluggish aspiration. And after 10 session treatment, he has had a smile, and he like to chat with me and talking a lot of topic. So get much improvement. But this patient total 10 session treatment and stopped due to financial problem. He can't afford more treatment. So let me introduce what is 14 location line acupuncture. 14 location line acupuncture, it was set up, established, completed in 1989. It's called the International Standard Scheme for Scalp Acupuncture. The features of the points of 14 lines is to lay down those points, total 18 points, on corresponding cerebral region. Then each line connects 2 points belongs to relevant meridians. Scalp acupuncture, I think most doctors know that the scalp acupuncture has different scalp acupuncture. First, scalp acupuncture, that the terminology that the public to announcement to public from Dr. Jiu. At that since 1970s, in fact, a lot of scalp acupuncture specialists, let's Fang's scalp acupuncture, Zhu's scalp acupuncture, and also my tutor, Zhishun Yu scalp acupuncture. So due to 1970s, a lot of scalp acupuncture and the WFAS, World Federation Acupuncture and Max Society, so call for that meeting and set up 14 line scalp acupuncture. So covers all advantages from different kind of scalp acupuncture. This Dr. Jiu, this Feng scalp acupuncture set up by Feng Yunpeng Fang, but this man is Yunpeng Fang's son, Ben Zhengfang. This Zhu Mingqing, Zhu's acupuncture is still popular. Yeah, so Zhu Mingqing is my tutor, Professor Yu. Let me summary. Acupuncture for Alzheimer's disease without side effect and adverse reaction compared to Western medicine. Western medicine treat Alzheimer's disease. Currently, 2 drugs cause a lot of side effects. So my 2 cases, case A, case B, didn't take that medication. Standard acupuncture, second summary. Standard 14 line scalp acupuncture is easy to operate, highly practical. It can be popularized and applied to cerebral disease. So currently, I realize scalp acupuncture not only use related to cerebral diseases such as stroke, MS, Parkinson's syndrome, and also can be useful for dementia, Alzheimer's disease. Third summary, scalp acupuncture in the treatment of Alzheimer's disease with durable efficacy and low rebound. It restores retentive memory, clean focus, and confident decision-making by increase the level of acetylcholine, 通过提高乙酰胆鹼。Fourth summary, scalp acupuncture is the preferred solution for the treatment of Alzheimer's disease in TCM. The scalp acupuncture has preventive treatment for Alzheimer's disease, which is characteristics of traditional Chinese medicine in 5. Last summary, we think that scalp acupuncture can regulate the brain circulation, clean off the amyloid and tau protein, and increase the level of acetylcholine in the brain so that improvement the symptoms of AD. So my talk finished. Thank you everyone for your joining us. Goodbye.
Thank you, Dr. Dr. Nia gave us a good speech and about the scalp acupuncture for Alzheimer's disease. Yes, we know we have not aware that Alzheimer's syndrome is increasing lately and affect human beings, especially for elders. And so hope use the TCM acupuncture and to help this patients to give them the normal life at the old time. So very thank you, Dr. Mie. So next speaker is me. My name is Tao Xu. A registered Chinese acupuncturist in British Columbia. Graduated from Beijing College of Traditional Chinese Medicine in Vancouver in 2007, under the tutelage of Dr. Li Wenpei. I once did a clinical practice in the cardiovascular and cerebral vascular department and the acupuncture department of integrated traditional Chinese and Western medicine in Beijing, China, Japan Friendship Hospital. I have 13 years of practice in British Columbia. I'm good at acupuncture and the traditional Chinese medicine of gynecological diseases. In recent years, I have studied TNE acupuncture and the tutelage of Professor Li Ronggang, and has greatly improved the effect of clinical acupuncture treatment by applying the treatment concept of TNE acupuncture. So today's my topic is TNE Shen You needle method theory and practice. My topic is UTCMH acupuncture, Shen You needling technique, theory, and practice. First, let me introduce the founder of UTCMH acupuncture system, Professor Li Ronggang. Professor Li is a disciple of Liu Zhiming, who is a master of traditional Chinese medicine, doctor of medicine, tutor of doctoral class, and author of the science of UTCMH acupuncture system. He has specialized in the acupuncture for a long time and has nearly 30 years of clinical and teaching experience. He has taught in many international Chinese medical schools in Canada, and his students have spread to many countries and regions. He invented the universal traditional Chinese medicine holistic acupuncture treatment system. Professor Li Ronggang is currently chairman of the organizing committee of World Traditional Chinese Medicine and Acupuncture Cultural Week, founder of Home of Canadian Traditional Chinese Medicine Society. An overview of the theory of Tianyi Shenyou. Tianyi Shenyou is a phenomenon which, after needle insertion, the needle body starts to swing involuntarily because of qi activation, which is called shenyou. Shenyou is the external manifestation of getting qi, 得气, and the spirit, 得神. Focus the syringe on the needle tip at insertion and to activate qi on the acupoint are the two key conditions for creating shenyou. Fullness of qi at acupoint and needle handle swing are the characteristics of shenyou. Origin of Tianyi Shenyou. The three treasures of the human body, essence, qi, and the spirit. Essence, qi, and spirit are called the three treasures of the human body. The TCM classics 内经 said, accumulate the essence and the whole mind to maintain health. When qi is full, the spirit is alive. When qi is deficient, the spirit is miserable. Therefore, qi is called the mother of spirit. The spirit is the master of life activities, and the essence, blood, body fluids are the material sources for supporting the spirit. These basic substances of the human body belong to the fundamental components of the human anatomy. The body houses the spirit, and the spirit cannot exist without the body. Treating the spirit is the key to the effectiveness of acupuncture, which runs through all the main links of acupuncture. According to Neijing, places acupuncture in the treatment of spirits in a very high position, and later physicians attach great importance to it. Treating the spirit is the key to the acupuncture's efficacy and the key to all aspects when performing acupuncture. The acupoints are the place where the spirit flows in and out, and they are the points to use acupuncture to regulate qi and to treat the spirit. Evaluating Shen You's efficacy, the TCM practitioner can evaluate Shen You's benefits to qi regulation, to harmonize the spirit, and to eradicate diseases from changes on pulse, on acupoints, on the meridians, and the viscera. The holistic view of UTCMH acupuncture system for treating disease, emphasizing on regulating qi to treat body as whole and inducing Shen You as the key in treating diseases. It is the core concept of using acupuncture as the treatment to cure holistic both body and spirit before attempting to cure diseases. This concept greatly improves the acupuncture efficacy in clinical practice. Referenced and further developed the concept of using acupuncture to treat the spirit documented in Neijing, and put forward the theory of 4 levels of Shen You. The theory and the clinical application of UTCMH acupuncture is the realization of the theories described in Neijing, thus transforming theory into clinical applications, demonstrating the theory's efficacy and its miraculous effects. Shen You is developed from the clinical practice. Tianyi Shen You theory recognizes that the spirit is an important external manifestation of the physiological functions and the pathological states of the viscera. Through Tianyi needle, it promotes the generation of acupoints, meridians, and viscera throughout the whole body, and helps they adjust and restore acupoints, meridians, 脏腑 organs and other organs. The function of the whole body can cure diseases of different parts and the whole body. It can also adjust the qi and the blood functions of the meridians and the viscera and the whole body through 天一神游, improve people's mental state, and achieve the purpose of health. The conditions and the methods of 天一神游. The practitioner will need to treat the patient's spirit first before starting the needle insertion. The fundamental training required before the practitioner can treat a patient's spirit includes indoor inner strength training to enhance the practitioner's physical fitness. Practice Tai Chi to move Qi with mind. Practice finger strength and hinting finger sensations. Practice the basic needling techniques in such a way as to be able to regulate the qi within a meridian pathway. Before receiving the acupuncture treatment, the patient should be in a calm state of mind. The book 标游赋 mentioned that anyone receiving acupuncture should be alert but calm. Otherwise, the person is not in a proper state to receive the treatment. The above phrase describes that acupuncture is a suitable treatment only when the patient is mentally alert but at rest, and the pulse is calm. The book Golden Needle and the Plum Blossom Poems said, the patient will also need to place a great trust to the treatment and to the practitioner, so that the patient does not move when seeing needle insertion. Then the treatment efficacy will be double. The above phrase describes that placing trust to the practitioner and calming the mind during treatment are very important to effective acupuncture treatment. The concept of a harmony between the practitioner qi and the patient qi during needle insertion. When the practitioner treats the patient's qi, the practitioner's qi follows the needle to enter the patient's body. Next, the practitioner's qi stimulates the patient's qi, and the two qi resonate one another. For example, when the patient's qi is weak, less strength must be applied gradually when performing needle insertion. Thus, it would be possible to stimulate the patient's qi to resonate with the practitioner's qi. When holding the needle shaft, the practitioner needs to concentrate qi into his or her two fingers, thumb and index, building up sufficient strength to guide the needle tip, penetrating the skin. First of all, the doctor and the patient should communicate to be ready for one another. The qi from both parties should be in harmony with each other. Next, the practitioner performs the needle insertion at the best time. The needle becomes the medium to carry the practitioner's qi were the two fingers to arrive at the patient's body. To realize the Shen Yu, different needling insertion technique is needed based based on the clinical situation. When it is realized, the practitioner's qi follows the needle to wake up the patient's body qi, triggering resonance between the qi in the practitioner to the qi in the patient. When manipulating the needle, Shen Yu will be shown when qi is moving under the acupoint. This is the phenomena described by the ancient practitioners. Ling Shu 9 needles and 12 originals said, the key to step is that it is effective when qi reaches it. Zhang Zhicong said, to acupuncture practitioners, the most important thing is to get the spirit and qi. The ancients also said, the spirit is upright. From the above records, it can be explained that the movement of the spirit is the movement of the qi, and the spirit and qi follow and cannot be separated. The meridians are unobstructed, so as to realize Shen Yu. Qi is between the fingers when manipulating needle. Qi is between the fingers when manipulating needle. The practitioner should be concentrated and calm. His or her mind should be on the needle. At the same time, she or he has to pay attention to the patient's reaction and tell the patient to experience carefully about the feeling of the needles. Practitioners should carefully pay attention to the changes in the needle and distinguish the upright and pathogenic qi to realize the signs of qi. De qi is the key to determine the effect of acupuncture. When manipulating the needle, Shen Yu will be shown when qi is moving under the acupoint. Ling Shu 9 needles and 12 originals says, getting visible is common, but best is getting invisible qi. It tells us in clinical treatment, acupuncture methods should be flexibly used according to the changes of the patient's essence, qi, and spirit. The purpose is realized Shen Yu during manipulating needle. Clinical application of UTCMH acupuncture system. 天一神游 needle method can keep qi and move qi. According to 天一神游 needle method, it is easy to get qi and spirit because the qi is accumulated in acupuncture site. When practitioner manipulate needle and the qi reaches the disease place, the 天一神游 acupuncture method focuses on treating the spirit and guarding the spirit, so it can maintain and strengthen the sense of acupuncture and achieve the clinical requirements of holding and moving qi. 天一神游 needle method to adjust qi. After getting qi during 天一神游 needle method is given, it is necessary to regulate the qi. Otherwise, even if the De Shen has been obtained, it will disappear quickly, so that the timing of treatment will be lost, and the clinical treatment purpose will not be achieved. In clinical treatment, according to the nature of the patient's symptoms of cold, heat, deficiency, and excess, The 天一神游 needle method can be used to regulate qi and treat the spirit. And the 天一 tonifying and reducing methods can be used to reconcile yin and yang to achieve a normal balance, thereby curing the disease. Tianyi Shenyou needle method can do heat producing needling and cool producing needling. Tianyi Shenyou needle method means that qi is gathered between the two fingers. It is easy to produce the effect of heat producing needling and cool producing needling. Now let's watching a clinical video demonstrations generated by 天一神游。
天一神游针法是临床上达到治病疗效的关键一步。进针时，应针下得气，气缠绕针体，力贯针中。气满后，针体摇摆晃动，此种摆动不同于肌肉收缩至针，也不同于针刺腹部穴位由于呼吸时造成的针体的摇动，以及针刺大血管附近针体的摆动。神游是一种气满之后的外在表现，是针下得神得气的标志。神游能够收气、行气、调气，也可以烧散火、透天凉，故应该创造神游。天一神游针法临床上适宜于内科、妇科、五官科及疑难杂症。天一神游针。
Now I will instructions of 天一神游 needle method. The 4 levels of 天一神游, specifically, it includes 天一 acupoint 神游, 天一 meridian 神游, 天一 visceral 神游, and 天一 whole body 神游. 天一神游 needle method is to treat people. 天一神游 needle method mainly focuses on treating people, and treating spirit means treating people. Chronic disease require the realization of whole body 神游. The 天一神游 acupuncture method opens up the patient's 12 meridians, 5 internal organs, 6 full organs, and the whole body, so as to achieve the purpose of treating systemic disease. Man is an organic whole, and spirit controls the essence, and qi is the master of life activities. 天一神游 uses the needle to regulate the spirit and regulate the qi, and clinically the goal of treatment is treating person first, then disease is cured. In the 天一神游 needle method, the needles are inserted, performed, and released to regulate the qi and treat the spirit, and finally form a state of 神游. That's all my content for today's speech. Thank you for watching. Our next speaker is Pratama Natasha Ram. Are you there?
Hi, good morning.
Hi, good morning. Yeah.
你好.
Are you ready to start?
Yes, I'll get my video started.
Before I start, I introduce you your background. Okay.
Thank you.
Yeah. So our next speaker is Miss Pratana Natasha Ram. And she is a graduate from PCU College of Holistic Medicine, TCU Chi International College of Traditional Chinese Medicine. And then Miss Ram is works and training in international medical training and preceptorship facilitation of international healthcare worker, training in women's centered care and mental health awareness, author and co-contribute of pro-health, nutrition, and traditional Chinese medicine books and resources, biomedical science instructor, private education facilitator, human rights advocate, and an active author. Now we're glad to have Miss Ram to give us a lecture today. Her topic is trauma-informed Chinese medicine. Miss Ram, please go ahead.
Thank you. Could I share my screen?
Yes, sure.
Thank you. Thank you for that wonderful introduction. So thank you for having me. I am the owner and practitioner of Mind Body Shen Integrative Medicine and Wellness Practitioners, growing medical practice here in beautiful British Columbia, Surrey, BC. I did want to talk a little bit more about my background. I was going to Douglas College and I took a particular interest in the general sciences, athletic training and rehabilitation. I attended University of Montreal and Simon Fraser University, where I studied human biomechanics and kinesiology. And I took up an internship with Simon Fraser and to work with the varsity teams. And this is where I had my curiosity into global health related issues and public health and human rights. I was accepted into natural and traditional Chinese medical schools, which I started my path into alternative and complementary medicine. And I was elected the president to lead a group of Canadian students into South America, which I had a great interest in international medicine, participated in the development and training of women-centered care and mental health awareness programs. I was the valedictorian for the graduating class of 2019. And as mentioned, I am an author and co-author for Pro Health Nutrition and Traditional Chinese Medicine books. Currently, I am the biomedical science instructor at BCC, PCU College of Holistic Medicine, and a human rights advocate, active ally. And interestingly, I DJ as well, and I compose under the name of DJ Nat Realist. I know that some of these ideas are a little bit different for Chinese traditional medicine and the foundations of. I do want to keep an open mind for this discussion today. And so I'm always happy to speak with anyone, or if you wanted to connect with me for more information, I'm more than happy to take in those questions and requests. So today we are talking about trauma-informed Chinese traditional medicine. So going straight into definitions, what the relevance is in practice. Then the dynamics of TCM foundations of mental and emotional connection, disruption of function of qi and vitality and shen. Then into approaches of mental health, trauma responses in TCM theory. Then just a brief look into restoration and rebalance, complex mental disorders, and prolonged suffrage. And this is where restructuring some of those concepts in TCM will come into play. And finally, guiding principles to trauma-informed approaches, clinical education, and universal precautions. So trauma is defined as an event or a set of circumstances that are physically, emotionally harmful and can be life-threatening and adversely affect how the individual functions in society, ultimately affecting their mental health, physical, social, and emotional and spiritual health. Acknowledgement that trauma shapes an individual experience and organizations that deliver the care and provide the education must be attuned to these experiences to interact and collaborate in a way that is culturally sensitive, transparent, establishes rapport, and empowers its members. So just to define, there is a number of dimensions of trauma, including magnitude, complexity, frequency, duration, which occurs from an interpersonal or an external source. These dimensions can be seen in the descriptions of the following types: single incident trauma related to an unexpected or overwhelming event, such as an incident, natural accident, natural disaster, a single episode of abuse or assault, sudden loss, or witnessing violence. Complex or repetitive traumas related to an ongoing abuse, domestic violence, war, ongoing betrayal, often involving being trapped emotionally and or physically. Developmental traumas resulting from exposure to early, ongoing, or repetitive traumas, such as infants, children, and youth. Intergenerational traumas describe the psychological or emotional effects that can be experienced by people who live with trauma survivors. And finally, historical trauma, accumulative emotional and psychological wounding over the lifespan across generations, emanating from a massive group of trauma. Reactions to trauma vary from person to person from minor disruptions in an individual's life to debilitating responses. The psychological adaptations that some people develop in the response of trauma to perceived ongoing threats produce an underlying state of dysregulation, difficulty controlling or regulating emotions, reactions, or behaviors, and or balance in the body. When one can develop chronic pain, gynecological difficulties, gastrointestinal problems, asthma, heart palpitations, headaches, musculoskeletal conditions, and affecting their range of motion or general mobility. Dynamics of TCM. The experience of having to manage trauma can overwhelm the movement and direction of qi. The organization, flow, function, and vitality of our qi can present as if your patient has physically injured due to a traumatic event, and more likely to have a long-term effect in the body if the practitioner is unable to identify and treat the root. When working with survivors of trauma in the scope of natural and traditional Chinese medicine, life is rooted in the rhythm created by its dynamic and fluid system of opposing poles of energy. It guides and holds our lives, more commonly known as yin and yang balance. Biomedically, this would be similar to the autonomic system, the branches of the sympathetic nervous system, the SNS, and the parasympathetic nervous system, the PNS. When qi becomes acutely disorganized, it could push the SNS into activation. In chronic conditions, patients could continue the dysregulated movement of qi and create a perpetuating cycle of the activation of SNS. The signs and symptoms can be seen in deeper layering of the shen and vitality. The continual battle of SNS with traumas will cause the PNS to lose its capacity to regulate the SNS, and where yin loses the capacity to soothe and quiet yang, yang loses the capacity to activate and enliven yin. Traumatic distress can create highly complex physiology and affect our ability to mentally process and get into coping mechanisms. Severe traumatic distress is within every layer of the human experience of one's mind, body, and shen. Before we're able to explore any trauma and the effects of qi, vitality, and shen, understanding the grassroots of traditional Chinese medicine, yin and yang organ pairings, the emotional properties are worth a mention. The diagrams here include other descriptives of emotional states in which we are familiar from our basic foundations of TCM. These new descriptions should enhance our clinical diagnostics method by identifying parameters of possible traumatic distress and also beginning to treat a trauma survivor. Let's explore further. So lung, sadness, grief, and detachment. Spleen, worry, dwelling, and perpetuation. Heart, joy, restlessness, depression. Kidney, fear, willpower, insecurity, isolation. And finally, liver, anger, resentment, and frustration. I can appreciate that there's many attendees at this conference with various understandings of TCM and the foundations. And so I'll take some time to define the tenets of some of the yin-yang organ pairings and the functions and signs of imbalance affecting qi, vitality, and shen. Lung function. Respiration brings energy from the air to help to distribute it throughout the body. They work with the kidney to regulate water metabolism. They're important in the immune function and the resistance to virus and bacteria. They regulate sweat glands, body hair, and provide moisture to the skin. When there is an imbalance, shortness of breath, shallow breathing, sweating, fatigue, cough, frequent cold and flu, allergies, asthma, and other lung conditions like dry skin, depression, and excessive crying. Energy, keeping the blood in the vessels. Connected with the muscles, mouth, and lips, and also involved in thinking, studying, and memory. When there's an imbalance or disruption, tiredness, loss of appetite, mucus discharge, poor digestion, abdominal distension, loose stools, diarrhea, weak muscles, pale lips, bruising, menstrual blood flow or dysregulation, and other bleeding disorders. Heart regulates the blood circulation for blood vessels, responsible for even and regular pulse, and influences vitality and Shen. Mental prowessness, connected with the tongue, complexion, and arteries. Imbalances, insomnia, heart palpitations, irregular heartbeat, excessive dreaming, poor long-term memory, psychological disorders. When joy is in abundance, there's restlessness and agitation. And when deficient, we could see depression. Kidney function, key organ for sustaining life, responsible for reproduction, growth and development, maturation, involved in lung in water metabolism and respiration, connected with bones, teeth, ears, and head hair. When there's an imbalance, frequent urination, urinary incontinence, night sweats, dry mouth, poor short-term memory, low back pain, ringing in the ears, hearing loss, other ear conditions, premature hair, graying hair loss, osteoporosis. Liver function, involved in smooth flow of energy and blood throughout the body, creates bile secretion and stores blood. It is connected with tendons, nail, and eyes. When there's dysregulation, breast distension, menstrual pain, headache, irritability, inappropriate anger, dizziness, dry, red eyes, and other eye conditions, and tendinitis. Some of the bigger energies and faster traveling emotions was but not remain here. And we will further discuss this in trauma responses and TCM theory. A few more conditions that are related to emotional and organ imbalances that traditional Chinese medicine practitioners will diagnose are rooted in trauma, blood stagnation, chronic pain, chronic and acute pain, blood deficiency, headaches, dizziness, fatigue, and stomach heat, which would cause digestive issues. So let's refocus our discussion on TCM approaches in mental health. Many ancient Chinese texts have contents pertaining to the syndromes, etiology, and treatment of trauma caused by extreme emotional changes using the concepts of yu and using, which translate to not flowing, entangled, blocked, or clogged. The Yellow Emperor's classic in the internal medicine is usually considered the earliest Chinese classic medical text in the world. It explains the relationship between emotional changes, the 5 viscera, namely the liver, heart, spleen, lung, and kidney. The 5 viscera parallel to the 5 elements in turn the emotional response. Wood, liver and gallbladder. Fire, heart and small intestine. Earth, spleen and stomach. Metal, lung and large intestine. Water, kidney, and bladder. The initial trauma experience is often due to significant emotional changes causing dysregulation in liver wood. In acute changes, traumatic distress is described as excess. Due to the changes and disruption. In chronicity, the classification changes to deficiency. And in more complex disruptions, the layered traumatic distresses into both deficiency and excess. Liver qi does play a vital role in the precipitation of trauma-related episodes, and stagnation of liver qi is a part of the excess type of classification. Conventionally, when there's an emotional change related to trauma, the liver qi is often affected first, followed by disharmony of qi amongst the 5 viscera, moving from the liver and conflicting with spleen and the heart, resulting in loss of regulation of qi and blood. If liver fails to control the dispersion of the function of spleen, it will be repressed. This will lead to the dissipation of harm to heart qi. If the heart loses nourishment, then the shen, which is the spirit, becomes restless and will lead to severe instability. Shen is used to point out the whole field of the emotional, mental, and spiritual aspects of the human being. Shen not only indicates the heart, but it also encompasses the emotional and mental and spiritual phenomenon of all our organ systems. So we'll head into restoration and rebalance. So when looking at complex disorders or prolonged suffrage, would the mobilization response, strength for fight, strategy for flight, anger or collapse, lack of assertion predominates here. Unable to complete a survival response rooted in fight or flight in the past, they'll look for avenues to complete it or enter into a state of hopelessness. Furthermore, fire, restoration of the relationship between our shen and our mental mind. When we see the flat emotions, memory and cognition are slow. They are socially inhibited and very anxious. They can look you in the eye. It is very hard for them to feel vulnerable and safe in relationships. Earth, nourishing and harvesting the lessons. Digestion is shut down. They can't receive anything, hold on to anything, digest or integrate these experiences. The stomach and the spleen help us break down our stories into digestible bits, digest that crystal, and harvest the lessons from life's challenges. Metal, first breath, last breath. Awakening our threat response, grieve for loss. There's a very primal sense of shutdown. It is hard to inhale, to receive life and any gifts that are here for them right now, or to exhale and let go of their past, especially when there's underlying survival guilt. Water, the arrestive response, preparation for threat. Fear and lack of fear predominates here. Unable to sink deeply and fearlessly into themselves. Their eyes can't sit still, scanning anxiously and fearful attention. Unable to successfully amount to mobilization response from the past. Their traumatic stress manifests as hypervigilance, alert, or its opposite, collapse and frozen, agoraphobic when it's at its extreme. How could we look at trauma with honor to our current foundations while updating our knowledge to encompass survivors of trauma? TCM does not have specific descriptors or patterns for trauma survivors, but has guided roots in disharmony of yin, yang, organs, elements, pathogens, vitality, shen, blood, and qi. The concepts that I present here are one of my own and understandably may not be as I have owned and operated Mind Body Shen during the entire time of the pandemic. There were commonalities between patients, treatments, and conversations that we're having during this time, mainly those of suicide and post-traumatic stress disorder, PTSD. I can provide a safe space during one of the most uncertain periods of time. Clinically, we were able to highlight a very private and stigmatized suffrage of suicide and PTSD. We must give honor to these groups of trauma survivors who are likely to suffer in silence, such as the LGBTQIA2S+, who are lesbian, gay, bisexual, asexual, intersex, asexual, two-spirited, countless affirmative ways in which a person chooses to self-identify. Also, those who suffer with mental health illnesses and addictions, marginalized communities, and our First Nations Aboriginals, just to mention a few. Practitioners must be able to have more of these difficult discussions with their patients to ensure their safety while in our care. There must be more value placed on enhancing our knowledge to provide the best care and also prevent health conditions related to traumatic events. Openly ask your patient about suicide, PTSD, and trauma. Listen without attaching shame. We are practitioners who share a space and time with our patients. And once there is an invitation to explore that trauma and the possibilities of suicide and PTSD, take it. Furthermore, we can start to develop our way of looking at traumas through the restructured lens of Chinese traditional medicine. This isn't the full list of trauma related to diagnostics and patterns that are related in cases at our clinic. But please consider the following. Unsuccessful completion of suicide, recovery and returning to yin and yang. Suicide is the intent to die and quickly separates the yin and yang for death. This pattern in diagnostics encompasses the energies harbored in yin and yang balance and they must return back to its main areas of the body to begin its recovery before there's any sort of balance that can be reestablished. The conflict of disorganization of the root is where tonification and nourishment must be focused. The tongue and pulse would be mixed between the dominance of yin and yang deficiencies. Furthermore, self-harm, mainly cutting, disordered blood within the superficial. Consider the disorganization of blood causing heat and pressure within the deep, moving towards the superficial layer. The most superficial being the skin, which is related to lung, as we mentioned earlier, related to sadness, grief, and detachment. Releasing blood from the lung skin reduces the pressure placed on the heart and the vessels, which directly relates to the mental mind. Tongue and pulse would be red, scarlet, enlarged with a strong heart pulse. PTSD, kidney unrooted, loss of opposing yin and yang balance. If there's a loss of kidney yin, yang can become overactive and manifest as heat and restlessness. Conversely, kidney yang deficiency, yin is exerting a greater influence, is associated with decreased activity, general fatigue, and libido. Remember, back to our discussion about kidney is related to fear, willpower, insecurity, and isolation. These emotions can float from the root and create trauma responses related to PTSD. The tongue pulse would be yang heat or yin cold dominance or a mixed appearance. Deep, weak, floating, chi position pulse. Patients can all be supplemented beautifully with herbal formulations of botanical medicine. Once the root causes of trauma are identified, the current signs and symptoms are treated. There's a few examples used. This is just a few examples that are used to guide in our clinic to treat and learn from our patients who are suffering with traumas. Trauma-informed practice, TIP, is a research principle that guides clinicians to incorporate these approaches in their clinic with their interactions with their patients. So here are some 4 guiding principles that you can use in your clinic and clinical practice. Trauma awareness. Trauma-informed approaches begins with building awareness among practitioners and patients of commonness of trauma experiences and how the impact of trauma can be central to one's development. Number 2, safety and trust. Safety and trustworthiness are established through such practices as welcoming intake procedures, adapting to the physical space and being less threatening, providing clear information about programming, ensuring informed consent, creating crisis plans, demonstrating predictable expectations, and scheduling appointments consistently. Number 3, the 3 C's, choice, collaboration, and connection. Practitioners should communicate openly, equalize the power imbalances in relationships. Allow the expression of feelings without fear of judgment. Provide choices as to treatment preferences. Work collaboratively with your patients. Strength-based and skill building. Patients in trauma-informed services are assisted to identify their strengths and further develop resiliency and their coping skills. If If this is a topic that interested you and would like to become more well-rehearsed in the topic of trauma-informed medicine, I could expand this topic with interest into a continuing education course or series. Furthermore, I recommend assist training to support specifically for suicide, where I will be certified to teach this course in the fall. I thank you for joining me today at the WTCM AW and I'm very grateful to Steve Wu and the organization for allowing me to share my love for natural medicine and Chinese traditional medicine approaches in trauma-informed care. I thank you very much for everyone who joined in, and stay well and healthy.
Thank you for Ms. Pratna Natasha Ran. She gave us a very good speech and a lot of information about the trauma and use the TCM concept to treat the disease, right? Very, very good, very, it's very rich content. Thank you very much.
Thank you for having me.
Okay, thank you. Our next speaker. Our next speaker is Shu Lan Tang. She will start at 12. 李老师。
大家好。Hello everyone. Please waiting 2 minutes. I'm Professor Tom online. Yeah, master online. Thank you so much. Thank you for everybody. Pay more attention. Thank you.
Hello, everyone.
Dr.
Hello.
Tom. Hi.
Hello.
Hi.
I'm sorry, I just finished work now. Sorry.
Okay.
I got 10 minutes late today, one.
Okay.
So it's my talking time now, yeah?
Okay. Okay, so
Okay.
it's now are you ready to start?
Yeah, can ready, yeah.
Okay, let me introduce your background first, okay?
Thank you.
Yeah. Okay. Now we have our speaker, Dr. Shulan Tang. Dr. Shulan Tang is professor, studied at Nanjing University of Chinese Medicine from 1979 to 1984, where she gained a bachelor degree in medicine. She then went on to study at Beijing University of Chinese Medicine from 1984 to 1987 and gained a master's degree in medicine. She worked in Southeast University Hospital from 1982 to 1991 as a physician in charge. Dr. Tang gave us a speech. The topic is TCM education in UK. Yeah, we welcome Dr. Tang give us a lecture now.
Thank you for your introduce. Thank you very much. And let me do this share screen, yeah?
Yeah, go ahead.
Share screen first. It's a Zoom, yeah? Share screen, and then go to my Zoom. My Wi-Fi is little. Let's see my Wi-Fi. Hey, my Wi-Fi is not opening. What can I do? Sorry. Hmm? See my Wi-Fi is can't. Oh, it's here. It's okay. Yeah. Hello, everyone. I'm so sorry. That's the Wi-Fi. What's on? Be on, yeah. Scream broadcast. Data. Open up the chat. ongoing meeting. Can you see my screen now?
Yes, go ahead.
Hello? Yeah, and first of all, thanks to Professor Longani to invite me for this forum. I'm very pleased to see everyone here today. And little excuse today, I just finished my work. I thought it was yesterday I figured out it was so tomorrow 12 o'clock. My PPT is still mostly in Chinese yet, but today my topic I would like to share the TCM education in the UK. The TCM, everyone knows it is traditional Chinese medicine. The education in the UK, I like to share this topic with everyone. So myself, as the host already introduced, luckily I started Chinese medicine in China since I was 16 years old. And then I had 5 years full-time training in Nanjing University of Chinese Medicine and went to Beijing University of Chinese Medicine. And came to UK since 1991. Now it's over 32 years now I'm here. When I came to the UK, I was still young. I was like still in my 20s. And I started my Chinese medicine clinic here. And in Chinese, described that is 如鱼得水. It feels a very good environment for me to treating people, because if I was in China and people would think I'm too young to be a Chinese medicine doctor, people traditionally want to see people with long beards and with older men to be a doctor. So I was young, but when I was in the UK, and patients here, they don't think about your age. They just want to get good result. So I was since I started my clinic in 1991 in Manchester, I was busy all the time, and lots of people want me share the knowledge, want me teaching them. So therefore, I also established my college, Shulan College of Chinese Medicine in Manchester. This in the picture, this is my college. Yeah. So as I said, my background is that was in 1979. I went to Nanjing University, graduated in 1984, and straight away I went to Beijing University of Chinese Medicine, and I did my master's degree in Chinese herbal prescription, followed one of the most famous Chinese medicine doctor, Professor Mian Wang, Master Mian Wang, 国医大师 in Beijing. And that was his office at home in 1995, back to visit him. And he is the 19th family generation of Chinese medicine. Like old days, and the Chinese medicine is within in the family, and they only pass to the son and not even a girl, a daughter, because daughter would marry to another family. So how lucky am I? So, and I'll get a chance to start at university with him as his student, and I learned so much from him, and he was so inspired on me. And so he even gave me like he write in the Chinese calligraphy post to me from Beijing to Manchester, said 丝求金子言其所思 要比地道自比精工. It means that you always have to understand it, study and understand the classic Chinese medicine, and you need always to develop and improve the knowledge. And also to understand what the theory and the practice is. So that he says, 医者义也，唯有悟性者为上功. It means as a doctor, you have to always constantly understand the human being and the nature and the connection as well. And then so you can treat people as a whole for their health, to maintain their physically and emotionally and mentally always in a very good balance. Here, when I started the Chinese medicine teaching here, it was just only 1 or 2 students, but I was still happy to teach anyone, even 1 student or 2 students. I always spend my time, my like a weekend or Sundays. I hardly ever have my Sunday off. I give my weekends to teach students. So gradually, my students become full of the class. So there's a lot of students. So up to 1996, my college have a cooperation international TCM higher education, high degree, like master and PhD degree education in the UK. So we have this master and PhD students as well. So at that time, a lot of students from everywhere, every country, from America, in the UK, Ireland, Netherlands, Switzerland, and Poland, Germany, French, and also masters and PhD students from all over the world, and Singapore as well. So our education was very busy. So, and then, so about the education, but in the UK, the main register of Chinese medicine is the most recognized one is the British Acupuncture Council. So, but the members, there are many, over 90% are West English people, yeah, and also another associations, RCHM, the Register of Chinese Herbal Medicine. These members are, most of them, they are Westerner. They studied Chinese herbal medicine. They can use Chinese herbs and prescribe the herbal medicine to treat their patients. So there's many acupuncture and herbal medicine registered in this country. Yeah. And also there's Royal Society of Medicine. There's more Western medicine scholars, but they are very open-minded. So they have received the TCM background members. And so I myself is also a fellow member of the Royal Society of Medicine in the UK. And here's a little, I didn't have time to translate in English on the PPT yet, sorry. So I want to say here is the character of TCM education in the UK is the acupuncture and the Chinese herbal medicine. They are not on the same pace. So like in China, when we started Chinese medicine at university, everyone started acupuncture and Chinese herbal medicine at the same time within 5 years. But in the UK, the most of the practitioners, they are doing acupuncture only, not really Chinese herbal medicine, because back to 1960s, so there's a group of Western people, English people went to China to learn TCM, but they only got picked up the acupuncture part. So they didn't go further for Chinese herbal medicine. Maybe they think that is more complicated. They don't know what the herbs are. Maybe how does it work. So they learned acupuncture. But also among the acupuncture, so they don't want to know the name of the acupuncture points. So because for the easy way sake. So they just put the numbers, say large intestine 1, large intestine 4, large intestine 11, using numbers to know and teaching. So now there's more become international standard acupuncture points. Use numbers as a standard rather than name like 合国屈指无力屈. And so therefore, because they started quite early, so this acupuncture is more towards to mainstream medicine, like such as BACC, British Acupuncture Council, and also the AACP. The AACP is the Association of Acupuncture Society of Physiotherapists. So the physiotherapists, they got maybe over 10,000 members, but among them maybe 2,000 or 3,000 members of physiotherapists learning Chinese acupuncture. So therefore they have an AACP association. And also BMAS is a British Medical Acupuncture Society. So it means the Western medicine doctors, the physicians and the consultant, they know the acupuncture, they have their own society. So in the UK, like main insurance company would insure BMAS members, but BACC and members also there's lots like private insurance company would also cover. About the Chinese herb medicine, actually it's a very important part of Chinese medicine. It's really only started in the 1970s. So there's Chinese people come to London or Manchester, Chinatown, they start a herbal shop. So therefore, we sell they sold the herbal tea. So therefore, the Chinese herbal tea are very popular in the UK. So when I came in beginning of 1990s. There's a big topic always on the TV or the national magazines say, oh, how important, how magic Chinese herbal tea can cure eczema, so it can see results so quick. So everyone wants to use Chinese herbal tea. And then at that time, people, there's acupuncture school in London also. They want me to start the Chinese herbal medicine teaching department, create a Chinese medicine department for the acupuncture schools in London. But at that time, the herb use pharmaceutical name or English name or Latin name to describe the Chinese herbs, and therefore they wanted me teaching that way. But I was honest said I'm not familiar with that. I prefer use pinyin to teaching Chinese herbs such as fulling, there's a fulling, chenpi, and the chenpi. So use the pinyin to do that. And then they accepted, and then they found out very interested. And then they all use pinyin in Chinese herbal medicine and the Chinese herbal prescriptions subject now. So now in the UK and Europe, all using the pinyin, the Chinese as Chinese herbs. So through the pandemic, they give so much spaces for Chinese medicine to develop in the UK. So a lot, and for the past 2-3 years, I found the Chinese herbal medicine is best weapon to fight the COVID, because when people have COVID infected and they had COVID-19, they isolated at home. They have nowhere to go. We can always video call, like online, to give consultation. We say, what you need is a non-heat or a non-E deficiency, or you call for phlegm. And then we can send the medicine out. Just like a minute before this online lecture, this because I have two patients suffer from COVID and cough. They want online me, and then I have to make prescription and send to them every day, and night and morning and over the day. I only had to cut the 1 meal through pandemic. Use Chinese herb medicine to treat so many and save so many lives for COVID-19. But thanks to UK government and the public, they are quite kind and generous to let Chinese herbal medicine to treat COVID and treat all sorts of people. So therefore, that's benefit for all the public members, and also it's a good way to promote Chinese medicine and also Chinese medicine have lots of space to develop as well. So I want to say here is this pandemic really forced the Chinese herbal medicine education to move forward. So I have so many queries, so many students want to know Chinese herbal medicine. Sometimes a group of 10 people want to know it. At the beginning, I just couldn't find time to teach them. But now, most of the time, I teach them online. And so my students from the UK, from America, and from China as well. So we are quite happy at this one now. And so this is about our cooperation. This is president of Nanjing University, Mr. Hu Gang. We signed a contract, said the cooperation cooperated with Nanjing University of Chinese Medicine to provide the higher education in overseas Chinese medicine. So we did quite a lot. And in 2018, so my college was together with Nanjing University of Chinese Medicine was awarded by China administration of TCM. So of this China UK TCM Center, that is, they have maybe about 30 centers around the world, aiming to from all diversity to develop Chinese medicine, not only TCM clinic and TCM, also TCM education and TCM culture and TCM products to help people. So that is in 2016, October, this head of TCM administration in China, Mr. Yu Weiming, Mr. Yi, visited my clinic, that my college teaching clinic. He was so interested in the Chinese herbal medicine and concentrated Chinese herbal powder as well. And visited the Chinese embassy as well. So, because our college is like one of the leading TCM education college in the UK, and there's a lot of media reported as like Guangming Rebao, Guangming Diary of China, to reported like reported our college like master. There's also already got the PhD degree now in gynecology, and also CCTV in China also came to report that our college so how to teaching this all Chinese medicine in good way. And also this is like in the pandemic first year, in the first year, the China Your Study also reported our college, so said we are especially how to become a character TCM developer in the UK and overseas. So because in the COVID, during the pandemic, we just didn't have any time to rest. Always constantly training people to give lectures. Sometimes I give more than 2 lectures, international lectures, more than 2 a week. All spare time just try to tell people how to prevent COVID and how to treat the COVID-19 by Chinese medicine. So I think my talk is just half hour. Yeah. So this is overall. This is like graduates, and in just before pandemic in 2019, and also before pandemic, we have a group of scholars from China to visit our college. And this one, they all came, all from different universities of Chinese medicine in China, or professors or head of departments. They visit our place. So I would say our college just like a crowd, like 海外中医教育的摇篮, like crowd of TCM education, just like for a little small, but we want to try our best to help people, to get more people to know Chinese medicine in the UK, therefore can help to benefit the public health here, to help people with all the illness, especially at this after pandemic time. There's so many long COVID patients, like brain fogs, chronic fatigue, emotional problems, cough, and tight chest and short of breathing, panic or insomnia, etc. So we all can help them. I find that only myself or a small group of practitioners wouldn't fit for so much demanding. So therefore, we want to speed up to training more young ones to be qualified in Chinese medicine practitioner, and then to help more people the health in the world. Thank you very much.
Thank you, Dr. Tang. Give us so many useful information, and we see Dr. Tang did a very good job then to educate the people overseas, let them to get some knowledge and even the technique about acupuncture and Chinese herb is very like a benefit as for the people all over the world. Thank you very much, Dr. Tang.
Thank you, Dr. Shita. Yes, thank you. I do apologize and for last minute to join in. Yeah. Okay. Thank you. Nice to see you all. Yeah.
Nice to see you again. Mm-hmm. Yeah. Now we have a break. Our lecture in the afternoon will start at 1:30. Please come back, join us again.
喂，听见吗？有声音吗？
Hello, Dr. Wang, right?
Oh, yes.
Oh,
Yeah.
okay. Yeah. Very clear. I can hear you.
Okay, thank you.我来试一下 share screen， 可以吗？
Yeah, okay. Yeah.
没问题吧？都好的吧？
都好的，好的。
清楚啊。等一会儿你们是要有主持人先开场吗？还是我直接就开始了？
Yeah, I will introduce you.
Okay.
First, then you can start. So, are you ready? Are you ready to start?
Yeah, I'm ready. So
Okay.
The time is not start. We can start now.
Yes. Yeah. So, before you start, I will introduce.
Okay. Understand. Okay.
Yeah. Okay. Now, welcome back. We have the session in English this afternoon. This is day 6. Our speaker is Dr. Tianjun Yang. Let me give the background of Dr. Wang. Dr. Tianjun Wang graduated from Nanjing University of Chinese Medicine in 1989. He completed his PhD at NUCM. Dr. Wang moved to the UK and joined the University of East London, UK as a senior lecturer and the director of Acupuncture Clinic 2007 to 2014. He is a guest professor of NUCM and the master and the PhD course supervisor and at UK Center of NUCM. Current Professor Wang is the principal of the London Academy of Chinese Acupuncture. Professor Wang is the vice president of the Scalp Acupuncture Committee of World Federal of Chinese Medicine Society and the president of the Institute of Scalp Acupuncture UK. He owns TJ Acupuncture Clinic and the Brain Care Center in London. Dr. Wang's topic for today is long COVID-19 related brain fog and brain acupuncture treatment. Now, welcome Dr. Wang give us a lecture.
Okay, thank you for Mr. Tao Xu the introduction. I did not notice you. Did you need to record it or okay? I did not notice anyone recorded. Do you think you need to record it or not?
I think.
Okay, it's up to you.
Yes.
If you need to
Yes, I need to record. Yeah.
Okay.
Sorry.
Because I did not find anyone recorded. Otherwise, I will start right now.
We are doing the recording now.
Okay, maybe I. Are you ready to record? Otherwise I will start now.
You can start now.
Okay, I can start now because I did not notice anyone recorded. Okay, anyway, I will start now. Okay, hello everyone. This is Dr. Tianjun Wang from London. And the topic of my speech today is non-COVID-19 related brain fog and brain acupuncture treatment. Thank you for the invitation from Canada, the second World TCM Acupuncture Culture. Thank you for the introduction. My background has been introduced by Mrs. Tao Xu, so I do not repeat it. Let's move on. Go direct to the talk. So, as you know, the pandemic now in the Western countries are almost clear. But the post-COVID-19 syndrome, or sometimes we call long-COVID syndrome, has been noticed in increasing in worldwide. As you can see from this, the references which was published last year, 2021, this review noticed one of the typical post-COVID-19 syndrome is the cognitive disturbance or called brain fog. So that is the quite earlier stage mentioned about the long COVID and the syndrome called brain fog. And so brain fog after COVID, what's this start? So there are not of neurological disorders, and particularly cognitive disorder has also been reported in patients who had a mildly or moderate form of COVID infections without hospital admission. So not only the severe cases in hospital, but also the mild cases. Many patients who have suffered from acute COVID-19 infections have long-lasting symptoms affect several organs, including the brain. So this non-COVID status can include brain fog and cognitive deficits that can disturb activities of daily living and can delay completely recovery. So that is quite common. Brain fog itself, we'll say, brain fog is not a new symptom. It was called cognitive impairment, has been noticed with or without fluctuation, including brain fog, which may manifest as difficulties with concentration, memory, receptive language, or in executive function feel confused or disorganized, or find it hard to focus or put thoughts into words. So Brain fog itself is not a medical condition. It is a term used for certain symptoms that can affect the ability to think. So brain fog has been described in some academic papers years ago. We mentioned brain fog has described in many academic years ago, which was not noticed or not widely accepted by medical. But after COVID, with the increasing of brain fog patients, nowadays, whatever the academic series or the practitioner researchers are all noticed this brain fog, partly of the coronavirus, they can affect the brain. So coronavirus is known to penetrate the olfactory mucosa, causing loss of smell, and may enter the brain, migrating from the cribriform plate along the olfactory tract or through vagal or trigeminal pathways. So coronavirus could pass the blood-brain barrier, or called the BBB, because in inflammatory cytokines induce BBB instability or via menocycles. So brain fog. Now we briefly summary about the brain fog in Western medicine. Now we move on. What understanding from TCM or acupuncture about the brain fog? In the literature review of TCM, there is no such term as brain fog. We have no name called brain fog. The similar symptoms, including forgetfulness, dizziness, absent mindedness, etc., are mentioned in TCM literature. The understanding of brain fog in TCM is still relatively new, and there is no research on it. As you may know, in China, the biggest database called the CNKI, in Chinese we call it Zhiwang, has no any report about brain fog. This is maybe related to the anti-COVID-19 policy in China is different with Western countries. Most of the TCM doctors or researchers has no opportunity to treat COVID patients. So you can imagine there is no any research on this as published. Overseas TCM practitioners have the opportunity to treat COVID and long-COVID, including brain fog. About 70 to 80% of long-COVID patients have brain fog symptoms, which is basically consistent with relevant overseas literature reports. According to TCM, it can be considered that the disease location is mainly in the heart and the kidney, involve the liver, spleen, lung, and other vesicle with treatment of Chinese herb medicine or traditional acupuncture extract. You may find some Western academics today focus on the brain acupuncture theory, guidance, the treatment for brain fog. Let's briefly review the TCM brain science. Due to time, I will not explain too much. TCM brain science, there are several highlights points. First, TCM has brain, not as some traditional textbook mentioned. TCM has no brain, or TCM some organs from traditional way. The brain is only one of the extraordinary organs, which is not highlighted and popularly practiced. But actually, from TCM brain science, we believe TCM has brain. And brain major function, it controls the life and the mental activities. It means physical activities and mental activities. And also, after the summary, the research, part of my book, we believe Dumen or gallbladder vessel is the channel of brain. As you know, for all the Zangfu organs, there are a channel affiliate related for the channel and the Zangfu organs. We may choose this channel and the point to treat relevant Zangfu organ conditions. For brain as well, dome or governor vessel is the channel of brain. We may use majorly use the dome or governor vessel points to treat brain conditions. The major references or the textbook from Huangdi Leijing called states, brain is the sea of marrow. Its qi transfers to the top of skull and lower the Fengfu to 16. Based on this theory, we can believe scalp acupuncture and the dome Dao Qi technique are the unique and most effective methods. According to the brain acupuncture, brain fog is located in the brain, involve the heart, kidney, liver, spleen, lung, and other organs. So the common patterns and the main treatment for brain fog as below. As you may know, because of the traditional TCM, brain is only one of the extraordinary organs. Unfortunately, there is no any brain patterns described in traditional textbook. After 2 to 3 decades research, nowadays we believe brain is the key organs of TCM. On the brain science, there are several brain patterns may be related to brain fog. First pattern is brain marrow emptiness. The main symptoms including brain fog, tinnitus, dizziness, depression, blurred vision, insomnia or lethargy, forgetfulness, brain noise, etc. With the pale red tongue, thin coating, thin or weak pulse. The treatment for brain marrow emptiness, we major use the dome point, such as dome 20 百会, the extraordinary point 四神冲, dome 16 丰府, extraordinary point 百劳, dome 14 大椎, dome 4 命门, and also some points such as kidney 3 tai qi, gallbladder 39 xuan zhong, etc. It can be used in conjunction with electric acupuncture, scalp acupuncture, abdominal acupuncture, etc. The second pattern is brain yang qi deficiency. The main symptoms including brain fog, depression, insomnia, forgetfulness, body chills. Hands and feet are not warm, fatigue, brain noise, pale tongue, weak pulse, points including dome 20 百会, dome 16 丰府, dome 14 大椎, dome 9 zhi yang, dome 3 yao yang guan, combined with moxibustion, scalp acupuncture, abdominal acupuncture, etc. And other two brain fog patterns are brain spread disorders. The symptoms including brain fog, depression, anxiety, irritability, insomnia, and loss of appetite, brain noise, etc. The tongue is reddish and the pulse is straining or slow. The points including dome 24 shen ting, dome 20 百会, dome 16 丰府, dome 14 大椎, yin tang. Here yin tang, for traditional we call yin tang is one of the extraordinary points. But recently, from China, I believe from last year to 2021, yin tang has been covered on the dome channel. Some books they call the dome 29. Some I believe the last standardization in China called the dome called the yin tang as the dome 24 plus. Now and the other points, heart 7, shen men, etc. It can be combined with electric acupuncture, scalp acupuncture, and abdominal acupuncture, etc. Another pattern called brain collateral obstruction. The symptoms including brain fog, headache, may include hemiplegia, central facial paralysis, aphasia, pain or numbness in one limb, brain noise, 四神冲, 动脉16风府, 动脉14大椎, gallbladder 20风池, large intestine 4合谷, liver 3太冲. We could combine with electric acupuncture, cupping, and scalp acupuncture. In terms of scalp acupuncture, there are several areas are commonly used to treating brain fog. The first point we can use is sensory area, or you can say the first area. This area is aligned, parallel, and 1.5 posterior to the motor area. This area, the major function is treating the sensory disorders of the contralateral side. Yeah, this area could be divided into 5 equal parts. To treating brain fog, we mainly choose the lower 2/5 sensory area. The second commonly used scalp acupuncture areas is foot motor sensory area. This area location is 1 centimeter natural to the midpoint of the midline. Draw a 3 centimeter long line to the posterior. This area could be used to treating paralysis, pain or numbness of the contralateral side lower limb, pain of the back and the neck, nocturnal enuresis, frequent urination, prolapsed uterus, poor memory, brain fog, etc. Next one for the scalp acupuncture area is we call the vertical auditory area, also called auditory area. This area is a horizontal line 4 centimeter long. Its midpoint on 1.5 centimeter above the apex of the ear. Can used to treat dizziness, deafness, tinnitus, auditory vertigo, Meniere syndrome, brain fog, etc. And next one, nowadays, it's also one of the commonly used one is split motion area. This area, we can use a 2 centimeter side of the anterior posterior midline, a 4 centimeter line from the vasomotor area to front. We can use this area to treating depression, stress, and anxiety, bipolar disorder, epilepsy, post-trauma stress disorder, insomnia, brain fog, and substances abuses, etc. Next one, we call nose, throat, mouth, tongue area, or called head area. From the midpoint of the anterior posterior midline with front hairline, draw a line 4 centimeter long, then 2 centimeter upward, 2 centimeter downward. This area can be used the center of the face problems, nose, throat, mouth, tongue related conditions, and emotion conditions. These areas are commonly used to treating brain fog. In addition, when we mention about the 动脉 points, particularly the 动脉16风府, this point from the 气动脉 channel, this point is the point enters the brain at the 动脉16风府, which means this point is the key point connecting the brain and the 动脉. From TCM aspect, the 动脉, but from the Western medicine area, exact underneath 动脉16 is the special area called myodural bridge. This myodural bridge connected the rectus capitalis, the posterior major, or the rectus capitalis posterior minor. Connect this muscle with the dural, which means if we need to do 16 in certain depths, it can directly stimulate the brain, could use to treating brain conditions directly. So whatever from traditional Chinese medicine, 动脉 point with the brain, or from Western medicine, anatomy structure, 动脉16 with use the Dao Qi technique with a certain depths, it can directly regulate brain functions. And after previewed basic introduction, now I'd like to share a brain fog case study. This patient is a British with 33 years old. Last year, January 2021, confirmed as the COVID. As you know, during that moment, the COVID was the second wave. Mainly, the virus was Delta. It was quite severe. After 2 weeks, he was tested negative, but still suffering from brain fog, anxiety, chest pressure, palpitation, fatigue. Energy level was 1 to 2 out of 10. You can imagine, very, very fatigued. And he can only do some activities less than 1 hour. He has no choice but to stop the business, loss of confidence, hopeless actually. He received lots of doctor's assessment, tests, MRI, EKG, blood test, all negative. So the doctor says, we can't treat you at all. We couldn't find anything. So during the middle of April last year, he came to see me, referred by a local acupuncturist. I mainly treat him with scalp acupuncture plus some other points such as central area, split emotion area, thoracic cavity area, including some other points such as 任脉 12 中脘 plus 任脉 6, etc. And also, after one week, he was described with some herb medicine. After first session, he's sleeping much better, brain getting clear, his energy level up to 5 to 10. After 3 sessions, he was improving 80%. Then I treat him with the frequency twice per week to once per week, and then once in 2 weeks, and even once in months. He was interviewed by the, as you know, the China Daily, we call the 中国日报, and published on the 24th September 2021. You can see this is the China Daily, we call the 中国日报. On the first page, with the report called the British Turning to TCM to help treat COVID-19. He was interviewed by the journalist, and also he said acupuncture was the only solution for him. And I'd like to introduce this book published on early 2021 called Acupuncture for Brain, Treatment for Neurological Psychological Disorders. This book I published to cover the first part called Acupuncture for Brain, the theory and the techniques, which covered the brain acupuncture theory and the techniques, including scalp acupuncture, Dutch technique, etc. On the second part, it is the treatment for brain disorders, including neurological diseases and psychological diseases. Yeah, we may use this book for guidance of treating brain conditions. Hope, as your reference. So now, as the short summary, I'd like to list here. The increasing evidence indicate brain fog, the post-COVID-19, is wide and severe. As we mentioned, about 70% of long-COVID patients had some level of the brain fog. And TCM has worked very well in against the post-COVID syndromes. For brain fog, acupuncture, brain theory, and the techniques may play a vital role for treatment for brain fog. Okay, that's all for my talk. And thank you for invite again. And also I list my name and my contact email. If any question after the talk, I'm happy to be contacted through emails and any other things. Okay, thank you again. Bye-bye.
Thank you, Dr. Wang, give us the lecture about the long COVID-19 related brain fog. Yeah, we noticed that, and like he said, about 70% of people got COVID. Maybe they have the brain fog, right? Yeah, so use the scalp acupuncture is quite effective to the disease. Thank you, Dr. Wang, give us very rich content. Thank you again.
Okay, thank you.
Wendy Yang, are you there?
Hi, yes, I'm here.
So you're ready to start?
Yes, okay, I can start now.
You can start now, right? Oh, okay.
All right, just give me a few seconds. Let me. Okay, I am now sharing my screen.
Okay.
You see?
Yes, you can see.
Okay.
So before you start, I would like to introduce you some background. So our next speaker is Miss Wendy Yang. She's a registered acupuncturist, and her topic today is holistic health, a way of living promoted by TCM. She is graduate from Kwantlen Polytechnic University. Yeah, so Ms. Wendy Yang, you can introduce yourself a little bit.
Okay, so, all right, it's my turn now, right? Thank you, Dr. Shi. Hi, everyone. My name is Wendy. Actually, I have been interested in Chinese medicine for many years, but I have only very recently I have had this opportunity to go to the school again after many years of working experience. I went back to school to get my official training, professional training on Chinese medicine. And start from last year, it has been a year now. I've been worked as an acupuncturist in British Columbia, New Westminster, a clinic in New Westminster. Through my very short experience compared to most of the speakers here, I have learned that Chinese medicine is really, at the beginning, I thought this is a very, very foreign and alternative way of healing for Western people. But through my practice, I realized that the people are so eager to learn a new way of healing their body, a more traditional way and a more natural way to treat their disease rather than taking the medication, which obviously everybody knows that a lot of side effects can occur after solving one problem, the other problem can come out. So during my practice, I am not only actually doing the the treatment, and at the same time, I also tried to explain to my patient what is the philosophy and what is the theory behind Chinese medicine. And also, I remembered, and I also told everybody that I can reach the Chinese medicine is not a way, it's not just a way to treat illness. It is more a way to prevent illness. So to be away from doctor actually is the goal of everybody, right? So to be good in to be to stay should I say to stay healthy, one should have to learn a way that the Chinese medicine has been promoted for so many years, a new way of living. So what is this way of living? Now this is the topic that I'm going to use the rest of the slides to explain. It's from the Huangdi Neijing, which is a very, it's like a Bible to all the Chinese medicine practitioner. There is a hierarchy for different type of health way of living. The top three is very difficult, of course. It's more of in kind of not for general public, not for everyone. But the last level, the 圣人 level, which is in English means a healthy person, is a goal for everybody. So what I'm trying to promote here is this type of to be a health person. How do we choose our way of living? From this Huangdi Neijing, we can see there are very clearly listed out three guidelines, I should say, for us, for people to follow. The first one is follow the law of the nature. In Chinese is 法则天地. 应该是法天则地, I think. Sorry for the mistake. The second one is 相似日月, which is move with sun and moon. The third one, 变列星辰, I would translate in English as recognizing the celestial influence upon human body and mind. The fourth one, 逆从阴阳, follow the movement of yin and yang. The last one, last but not the least, understand the effect of seasonal climate change on human and make the adaptation for our body to adapt to the changing accordingly. I understand that this is a big topic for 20 to 30 minutes presentation to cover. So I would like to narrow down my topic into top three most common aspects in our life. These top three are diet, exercising, and sleep. Before we go further, I think it was to explore the concept of yin and yang. As everybody may know the word yin and yang, but to understand it is, I think it's not that easy. It's quite subtle concept, subtle meaning in it. So here I would like to illustrate this cycle we see here is called Taiji, is illustrate Taiji, which is the state of energy before it's moving. When the energy moves, we see it's a cycle, moving in a cycle, rising up from bottom to top and falling down from the top to bottom, and it becomes 两仪, which is yin and yang. So this is more like a sun and the moon. In the morning, sunrise. At noon, sunrise to the top. This rising of the sun energy is the yang. When it rises to the top, which is the turning point at the noon, then this becomes, the energy is going from expanding state, turning into a restoring state, which we can see here is a kind of declining. It is not really declining, it is restoring actually. Then it moves into, when it moves into the bottom, which is the deepest level, the yang becomes start again. So when yang turning into the declining or restoring state, it becomes yin. So yin and yang is not a separated thing. It's one thing. It's different state of its movement. So this energy is constantly moving in cycle, from polarizing to emerging, to merging, to polarizing. It's like our breathing. Breathe in, breathe out, breathe out. It's on and on, never ending. So this manifested in the natural phenomena, as you can see, is the day and the night. So we call day is the yang energy and night is the yin. And sun and the moon, sun represent yang and the moon represent yin. Summer and winter. Summer, we have abundance of yang, and in the winter, yang goes deeper into the restoring mood, which is becoming more in, and heat and cold, of course. So we can put a very long list. I'm not going to do it here. Just give a little bit flavor about this concept. Okay, I find it's a little difficult to do this presentation here because there's no contact with the audience. Never mind, I'm going to continue. All right, so in our human body, same concept. We have, just a second. We have, actually, human body is about the same as the earth. In the morning, when we wake up, our yang, that restore the yang energy moving from the deep inside of the body out and start rising. And at noon, the yang energy rise to the top. After the noon time, past the 2-3 o'clock, our yang energy declining, which is becoming restoring, go deeper into our body. So by the time about the 9 or 10 o'clock, it's the time for the yang go into even deeper, and it's the time for us to go to bed. And the same for the season. In summer, our yang is more floating on the surface level of the body. In the winter, the yang is more restored in the deeper level of the body. So, using this yin and yang concept in our TCM it's the backbone of TCM. Actually, I understand that all the theory of TCM is developed from this yin and yang concept. And also all the treatment, no matter herbal medicine, acupuncture, massage, whatever, all the means of TCM treatment are using this concept to manipulate, I should say, help with the yin and the yang in our body to make it more synchronized with the natural environment so that we can stay healthy. And similarly, a TCM way of living is to follow this yin and yang movement pattern. For example, diet, food also has yin and yang properties. And also when we consume the same food, if we consume at different time, we take it at different time, the interaction, the food yin and yang and our body yin and yang, the interaction is different. And tonifying effect is also different. And also season factor is important with food. Different season and different location even can affect the harmonization of the food and our body. Of course, age is very important. We can have one food, same food, but very different effect to the body at different life stage. For exercise too, we need to choose a very suitable form of exercise, way of exercising, because different life stage, our yin and yang is different. So age is different. Age is important for us to consider which type of exercise we need to choose. And also during a day, what is best time to exercise? We should also use this yin and yang guideline to decide. I've seen a lot of debate about when is the best time to exercise. Is it morning good or is evening better? Lots of debates and no solid conclusion. Actually, it is really difficult to make a one-size-fits-all conclusion. But by using this yin and yang guideline, I think it's not too difficult to make the choice. And also season. Different season is different yin and yang state. So when we choose what to do for workout, we also need to take season as a consideration. Of course, intensity as well. Different season, different age, and different time are all, it's kind of all work together multidimensionally. We should put all of these factors into a consideration and to decide which is the best, which is the optimal way of exercising. Same for sleeping. We also, I heard a lot of people say that I sleep very late. Say one person I met in clinic, he said that I usually go to bed at 4 o'clock and wake up at 4 o'clock in the morning, wake up at 11 at noon. So he said, I still have more than 8 hours sleep. But is it good? We will, I think in the later slides, we will explore a little bit more. Okay, so let's move to more details. As I said before, food property. Food property is kind of energy of the food, because in Chinese medicine, we consider food as, we not only consider the nutritious factors of food, but mainly consider the energy of the food, like hot or cool or warm and cold. Like, is it which season this food is harvested, and where it is planted, where the origin of the food should all put into consideration. Actually, food and our body constitution, if we put it, we matched it very well, it can compensate the weakness we have. If not, it will be opposite. It can harm our body. Even a very nutritious food can harm our body. I have lots of examples, but I don't think we have time to touch that. So I'm going to pass. Now we move to about yin and yang in a day. You can see from this illustration, in left side is morning. It starts from midnight to noon. Is more of young rising stage. Right side, my right side is a declining stage. It's a young becoming when young comes to the top, and it becoming it changed to the declining or restoring mode. So it's a declining arrow here. You can see. Therefore, the yang energy within a day is not evenly distributed. It follows this pattern. So you can see when is the most abundant in yang, which is 9 a.m. to 12 p.m., right? So if we trying to, for example, trying to exercise, probably this is the best time. I'm actually not here to give any advice on when should we do what. It's just to give a pattern of Yang's movement so that everybody can choose based on their understanding what is the best way for them. And also this one is about year, 4 seasons. Actually, Chinese, ancient Chinese, they split a year into 24 seasoning points. Every 15 days is a kind of small milestone for a season change, for climate change. Within a whole year, there are 4 key milestones, which is in the deepest winter time. We call it 冬至. It's about December 22nd, 1 or 2 days earlier or later, around that time. And also, this is the time when yin is the most abundant, and yang is just the start from there. And then the next milestone is Chunfen, which is around March, if I remember correctly. This is the time that everything, the spring is very, very, the spring energy is the most rich, I should say. At that time, everything is becoming vivid and lively. This is also we call it Shao Yang. The Yang is very, Yang is high, but it's still young. It still have a lot of potential to grow. When it comes to the middle of the summer, which is around June, I think, June 22nd, around June 22nd. This is the time that the yang comes to the top. And when it is still very hot, like this time, right now, it's already past this top point. It's we are at the declining. At this season, the yang is already come to the declining stage. So when it comes to the September, that is another milestone for yang energy. It is still very very hot, we should say, but the yang is becoming declining, go into the deeper level already. It's preparing for the next start, which is in around December 冬至 time. So this cycle is very important for us to understand that without a very good expansion of the yang, the yin cannot be restored deeply, which will cause the next circle more difficult to continue. Same for our life stage. We have youth stage, we have middle age, which is around at the top. And then after retirement, we become, we go to the kind of last stage of the life. And this whole stage, in terms of the year, it can be very different. Depends on how we choose our lifestyle, how we take care of our body. But the stage, I think, for everybody is about the same. So we can see this curve. This wave is more to describe the yang up and down condition. So after my little explanation of this yin and yang pattern, and I'm sorry, this is a very abstract concept. It's very difficult to explain, especially in this this way of the way of working, like using a video camera. I'm facing myself. It's hard to get any response from the audience. So if there's any problems, maybe we can leave it for the future to discuss if we have the chance. All right. For food choice, I already said before, we have food property, the energy of the food compared to our own body constitution, our body needs. So these two, we need to make them very well coordinated. And food temperature as well, we need to consider what time we can have cold food. Like sometimes when we are very young, it's okay to have a little bit ice cream or cold foods. But when we come to the certain age, it can be more harmful. As one of my patients, he said that he is about 60 years, over, around 70 years old now. He said that I have cold water through my whole life. So when he said cold water is ice water, the water with ice cube, he said, I have that my whole life. Why I didn't have the problem when I was young? So this is, I think, in my previous slides explained why this is the problem. And also season, we need to consider which season to eat what kind of food. Actually, the food, like the plant, harvest in different season, in different area. There is a reason for that. We, as a part of the nature, we're supposed to eat food in the right season, as that's the food for us to consume at the right season. That's the gift from the Mother Earth. If we trying to eat the food against the season, it can potentially give us problems. And also, why we eat local, there's also a reason. For example, lots of people I know here in Vancouver, they eat a lot of bananas. And banana, I understand is is a product, is a fruit from South Asia, Southeast Asia, from a tropical climate. And here in Vancouver, our weather, our climate is very different. So a lot of people can get the eczema, can get a dampness from eating, just simply from eating banana. I also have this clinic case that a young girl, she had eczema for a long time. After I treated her for a few times, she got better a little, but then fall back again to the problem. I asked her why, what's her diet? She said that she has a banana almost every day. Then I taught her to how to eat, as I just said, just a simple explanation why she shouldn't eat banana. And she stopped eating banana. After a few weeks, she said that her eczema, I didn't give her any treatment because she's my colleague. She said that her eczema is much, much better. So this is, I think, is a proof for the point I just made. Okay, I think I'm going to skip this one. Oh, wow. Same as this banana case, I also have a green tea case. Green tea, as we all know, it's a very healthy drinks, which is highly promoted by a lot of nutrition magazine and articles. But I also know that some people, because of drinking green tea, they got a lot of problems. Like one of my friends, he lives a very healthy lifestyle, and he had recently he had a diarrhea. He had I checked him. He got a lot of coldness inside his body. Then I asked him ask about his diet. He said that he drank green tea every day, almost for many years already. So I said that this green tea could be the problem for his spleen yang deficient. So he stopped the green tea, and gradually his condition improved. So although green tea is good, it also needs to be carefully selected based on our body constitution. And also when to drink, for example, green tea. If we drink it after dinner, maybe at night, in the evening, probably it's a little bit, it's okay. But if we drink it in the morning, early in the morning, it will cause problem. Why? Because in the morning, our yang is just about to start. And green tea is cold, it's very cold. It could push the energy which is about to rising. This is the way of energy rising. And what's good for morning? Ginger tea. Why? Because ginger is a kind of, the property is very young, and it's if we have it in the morning, it can help us the yang energy expanding even better. However, if we drink ginger tea in the evening, it can be a problem. Why? Because the ginger tea is hot, and it encourages the yang to rise. In the evening, our yang is supposed to be restored in a deeper level. If we trying to encourage our yangs, to pour out of the yang, it's against the way of its natural movement, the energy's natural movement. So it can keep us up at night. can make us hard to sleep at night. Okay, this is the similar idea about when we need to have what type of food in which season. I'm not going to repeat here. I think I also have touched this point earlier. Exercising, same as I said before, we need to choose a suitable form for our age, and also we need to exercise at the right time. I think it's not hard to understand why lots of people debate what is good for exercising our body, like running is good, walking is good. I would say that it depends. It depends on how old you are and what time you do it. And also, when is the best time for us to work out? I think I have touched this point earlier. Summer and winter. This is actually, I think a lot of confusion here. We think that the winter is cold and we're supposed to have exercise more in winter. A lot of people even do the winter swimming. That is to swim in the ice cold water. Is it good? My answer, based on this yin and yang movement pattern, that is not good. As we can also follow this idea that yang is rising in the summer and the spring. So in the summer and spring should be we should encourage our yang energy to expand to its extreme. However, in the autumn and winter, our energy is turning from an expanding mode into a reserving mode, a declining, a restoring mode. So whatever we do is not to disturb this momentum, and we can just exercise a little, but not too much. This is, I guess, is against a lot of understanding. Same for sleep. As the example I gave earlier, people think that as long as they sleep a certain amount of time, no matter when they sleep, how late they go to bed. But this is not true. We can see that based on this yin-yang pattern, the yin-yang movement pattern, actually the best time for us to go to sleep should be around here. This lower right corner, lower right corner. It's from 10 o'clock. Maybe it's more difficult for modern people to do that. I think the latest time is 11 o'clock to 3 o'clock in the morning. This is the best time for us to be in a deep sleep. Even you only have 4 hour, 5 hour sleep. During that time will be much better than you sleep 8 hours in the daytime from 4 o'clock to 11 o'clock in the morning. As Pontine aging also gives some guideline for different how long we should sleep, when we should go to bed in a different season. It says that in the spring and the summer, we need to go to bed late and wake up early, which means that we can sleep a little less than in fall and winter. In fall and winter, we need to go to bed early and wake up late, especially in the winter time. We need the longest hour to sleep. This is also, I think, is easy to understand based on this yin and yang movement, and we need to restore the yang in the in the yin time, in the winter time, and in the at night, to make sure that we have enough yang to rise up in the morning. Last but not least, I would like to show this meridian clock. This is, I think, well known to every TCM practitioner. We can see that our body actually follow very strictly follow this internal clock, circadian rhythm. So this one is not. I think it's a little bit off track of my presentation, but I want to put it here to give a reminder that we do, our body is not just body, our mind is part of the nature. We need to follow the certain law that the nature works, so that our body can be synchronized with the environment we live, so it can be well. Otherwise, we may have problems. All right, that's my all I would like to share, and I'm sorry for a little bit brief. I hope that this is a big topic. I hope that in the future we can have more opportunity to explore this topic thoroughly, and can be a face-to-face session, which is more. It's a lot of discussion can be engaged. It's easier for me, for everybody, I think. That's it. Thank you.
Thank you, Wendy Yang. Give us a very detailed knowledge about the yin and the yang and how it impacted the food, exercise, sleep. Yeah, so everything. It's a lot of very rich content. Yeah, I think you have a lot of the knowledge about that yin and the yang's concept. Okay, thank you very much.
Thank you.
Yeah.
How do I
just stop sharing?
Stop sharing. Where do I do? What do I do? Okay. All right. I have a little bit difficult here. How do I go to? I couldn't find this.
You can see the top. Can you see the top?
Yeah.
There's the stop
yeah.
sharing. Yes.
Oh yeah, got it.
Thank you.
I got this screen. Did I stop it?
Yes. Yeah.
Oh, thank you. Thanks.
Okay. Our next speaker is Miss Erica Zhong. Erica Zhong, are you there?
Hi, can you hear me?
Oh, yes, yes.
We are actually ahead of schedule. Are you guys in for a break, or should I carry on?
If you're ready, you can start. Yeah. Continue. Yeah.
It's great for you guys because it's easy for me.
Okay, that's good. So we don't need to break yet. Okay, so are you ready?
Yeah, I can share my screen.
Okay, yeah. So before you start, I just want to introduce Miss Arika Zhong. Miss Arika Zhong is a registered TCM practitioner. Her topic today is walking the middle way. Yeah, you can introduce yourself a little bit because it's not enough information about you.
Sure. I actually have this. How do I? Did I share screen already?
Yes.
Okay. You can see about me, right?
Yeah, I can see you.
And how about my slides?
Yeah, I can see.
Perfect. I'm just wondering if I do play. Okay, perfect. So yeah, I have this elevator pitch prepared up. Basically, I'm still a TCM student, although I am a registered TCMP practitioner in British Columbia, in Vancouver and Coquitlam. I'm currently in Coquitlam right now in the clinic. So, and I'm also currently attending Doctor of Acupuncture Oriental Medicine, short for DAOM. My school is 5 Branches University. I've been enjoying my school there, and it's my final year, so final stretch. So I graduated just in 2021. It's a local school. Many people know about it, a lot of my colleagues. And so thank you for my colleague, Steve, invited me to join this wonderful platform. And thank you so much for the Home of Canadian TCM Society and CSSA, that's the Canadian Community Service Association, for providing this great platform so that all of us can be together in a virtual way. About 10 some years ago, I graduated from UBC. I had a double major, BA International Relations and Asian Studies. So I did a lot of diplomatic, commerce, law, that sort of thing for the last decade. And during that time, I also obtained my postgraduate diploma in advanced translation and interpretation, meaning that I do Cantonese, Mandarin, and English. We call it consecutive interpretation. So sometimes I work for conferences, do a little bit of the little brochure translation. And currently I'm working out of 2 platforms. One is Boda Health. We have us specializing in fertility. And then the other one is the one I'm currently situating right now. We are a multidisciplinary clinic. I work with a fantastic team of PTs, kinesiologists, what else? RMTs. Yeah. So my topic is 医者的中庸之道. So walking the middle way. So I'm basically it's a very casual way of sharing what my interpretation of the middle way, how to incorporate the TCM classics into like a more practical way, and how to communicate with our patients. So that's why I'm very grateful to be following Wendy Young's fantastic presentation, and our topics are perfectly matched. So thank you. Okay. Talk a little bit about the purpose. I don't know about the audience too much, but basically treat myself as a break to attract Jade and to have better speakers and more well-rounded topics to come up down the road. And also based on my personal experience as currently still a TCM student, but had the previous years studying, especially studying during COVID time where it was quite isolated. It was like a lot of changes going around, and just as a small advice, a little bit of tips provided to the current TCM students, if I may. And also as a way with my short presentation to establish a discussion framework for the general public, so that I often feel that our profession is vastly wise and vastly rich in a way that we can share with general publics. However, there's often, I feel, there's a disconnection. People only, when they talk about TCM, they only think about, oh, needles, oh, herbs. But in my way, I feel dearly that the TCM culture should be like, there should be a more audience-friendly and approachable way to be delivered to the general public. So hopefully this is something that I could, I'm still exploring it myself. So hopefully this is something that we could, I myself could continue to work with the colleagues. Thank you. Currently, due to my PhD work, I'm still having, so my project is a translation work. I'm translating Chen Xiuyuan's 医学三字经. So it's a TCM classic. It's in kind of plain ancient languages, so not very, very ancient per se. And I also like the fact that he has a very succinct way of delivering some in-depth TCM classics. I find it very beneficial myself when I was reading it, and I thought I'm trying to turn it into the English version that's approachable and beneficial perhaps to the TCM students. So that's what I'm, besides clinic work, that's what I'm working on. A glimpse of my clinical work. I'm currently doing part-time because I'm still attending schools. My weekly patient count's about 32 to 40. Or Jane App told me I have a client retention rate of 88%. And primarily I'm currently mostly are external injuries, a lot of ICBC cases, and some internal medicines. With the fertility case count is slowly climbing up. My modality is acupuncture. I do various types of acupuncture, 5 elements and all that. I love fire, wet cuppings, and I can get a lot of TCM classics when I was doing fire cupping and wet cupping and tell people about what the potassium means and what I'm doing to them. And I also practice sound vibration techniques, a type of medicinal forks, formula, TCM talk therapy, all that. Patient feedback I would like to talk about is that currently I received, I would think it's 100%, at least people are being very verbal about the appreciation that they're having an informed treatment. That you're not putting in needles and you walk out the room and work on someone else. And then you take the time to explain to them what you're doing to them and what's the likely effect or the likely side effects if available. They're also very appreciative that I'm holding a safe healing space. And within the space, we can bond and then we encourage each other. I get, most often than not, I get instant patient feedback on the treatment table. So I'm grateful for I find, at least for the past few months, I'm enjoying how I deliver that. Okay, who we are. So today's discussion, 3 stages. Basically, I would like to just briefly talk about what I view as our profession is a messenger. So we're here to deliver various messages, much of it included in Wendy's presentation. It's, how you eat, and, one food is a blessing to someone, but maybe poisonous to you even. So how we deliver the messages. We are a healer, first foremost, and an influencer. I would touch on that. A little bit different from the social media influencer, but I have my own understanding of that. I also view that our profession is a beholder of massive wisdom. There's endless wisdom in this profession. That's why I changed career track, and I went to school for a couple of years and ended up here. I'm still doing school. I just find this is a lifetime, endless learning track. That's why it's fun. And also, to summarize, I think we are versatile generalists. We need to be a generalist. However, we are very focused and we are skillful. So I don't know how many people's online, but I'm just gonna see if we can have a poll set up, and if anyone who is in this profession because of family trait, because of your parental influence, or you have TCM doctors from your family, type 1 in the chat box. I don't know if there's anyone responding. Anyways, this is warming up. And also, if when I was attending school, many students, of my peers were saying that, was sharing their life stories about how they seek help after multiple failures or after heartbreaks, and finally they found TCM. And that's why it sparked their own ambition to join the profession. So I also find that's very profound and very, it's a unique side. It's a unique affirmation or confirmation of our profession. So thirdly, I also came across with some people thinking that nowadays the mainstream medicines continue to show their limitation, although they are so wonderful on some counts. However, the alternative healthcare system is becoming more and more attracting to them. And the fourth, if someone who is with me, we pretty much enlightened and stimulated by this beauty of TCM wisdom. Okay, so I will also briefly talk about practitioner's duty of care. For me, it's very important for the initial visit to get it out, the macro and micro pathologies and lifestyle inquiries, basically to have as quick as possible to form a 3D image of the patient that's sitting in front of me. That's my step one. And step two, expectation management. We understand that we don't, like, it takes time for a certain disease or certain manifestation to come up, to be finally noticeable. That therefore, I often tell my patients that we are working together. I'm working for you, okay, and you need to help me in order to help you. So together, it's a patient-practitioner collaboration. You're not here to just light it and then magic, boom, happened. TCM is not like that. Well, sometimes, but not like that. So I want to make sure my step two is really to have a very warm, friendly, but very realistic discussion on how are we going to achieve certain goals and what are our steps. And the third stage, when I say we own the patient's duty of care, is consistency and continuance to provide this impartial care. We all have likes and unlikes. We are human, we're flesh. There are just some patients that you like, they're so cute, you know, there's a little girl coming into you, just naturally you have more motherhood love spurring out and all that. But I often remind myself impartiality, consistency. And these can all be found in the TCM classics. I personally think, especially during much of the time I was studying during the COVID era, I would say, you often feel isolated, you feel unsupported. Teachers are far away, it's all Zoom. But whenever I flip open the Neijing, when I flip open, let's say, 父亲主女科, anything that's passed down, like with trials and errors of hundreds of years of rich experience, I find this source of power, endless source of power, accessible, so reliable, cost-effective, of course. Yes, well, yeah, there are classes that we pay thousands and thousands of dollars for pulsing and acupuncture. But if you sit down and then look at the classics, you just have the sense of stability and support. Okay, the first role, I view myself, or at least for my peers, I would encourage you to view yourself as a messenger. So you never feel alone. You are delivering these supreme messages from the heaven to share with your patients. Don't be. I would say it's never easy when we're starting out. That's a fact. 100% patient education may not help us to get this 100% retention or patient satisfaction. But I feel very privileged whenever I'm with a patient in this safe healing space I held up for him or her. And this particular moment in space, all of us are called to deliver a message of health, so that something is planted within that patient. So even though down the road, with whatever reason, economical, insurance is up, or they're moving, they're relocating, they always understand TCM principles is going to be backing them up. This is something that they can always come back and visit. And our profession is a trustworthy one. So my goal is not to, grab a hold of this patient. You follow me the rest of your life. I'm gonna promise you this and that. And my goal is a little bit different. I want them to have the TCM wisdom with them after this initial contact. I would just like to share this little photo here. How do I read it? Yeah, a doctor 就是 doctor 不治已病治未病，不治已乱治未乱。To briefly just casually translate it is that often people say that you don't treat this the disease already manifested. You treat some things hidden. It makes it so magical, makes it so philosophical. Like, so what do I do if this person having this eczema and this skin issue? So I don't treat it. I just treat whatever the damn heat or the damn cold behind it. That is one way of interpreting. But my interpretation of classics sometimes is that we need to step one step further and understand the principle. My understanding of the principle is in the inner classics. It does a lot of this comparative, like the line back. There's certain principle behind it. Is that I'm not telling you to not treat or not treat, but rather what's your priority. Because in the ancient time, people are inscripting on the bamboo little, like a bamboo planks. They need to save wordings. So as long as they condense it, meanings get lost. So I often literally sitting in front of one line of sentence and then be there like for hours and just kind of step into the shoes of Qibor or step into the shoes of Yellow Emperor and then think what was the meaning really telling, embedding behind. So it's really fun, and it's fun to tell your patients and how we deliver these messages. I would say pick one or two important ones. For example, when you talk greatly about the seasonal changes and the 节气, and then often we say 五运六气, and all those things, get it out in the initial visit. It may be consuming, like in terms like energy consuming, but it goes a long way for that patient. There's a saying that I like, 不知天地人不可语言一. So if we don't look at the heaven, we don't receive the heavenly energy, we don't receive the earthly energy, we don't understand we are jamming in between, but also we are being supported by these energies. It's easy, so easy for us to feel lonely. Yin Yang and 5 elements. I don't want to go into the details. This one sentence say it all. This is the Tao. This is a way of the whole universe. Our ancient people often tell my patients, we're so blessed to have these sages, that figure everything out. This is the dualism of this earth. They figured it all out. And all what we need to do is, do the little work. The Tao is in your needles. However, it's also how we deliver these messages. Why things are changing. Because, in a dualistic earth, everything changes according to yin and yang, according to 5 elements. Then the patients get so excited. They no longer locked up in their little pathetic place thinking that why am I being sick and why am I suffering? We lift them out. I often put them in a conversation that they are supported by the whole universe. They're supported by the heaven and earth. The only way that they are having issue is because they're a little bit out of balance. And our job is to, day by day, tuck it back and put them back to a balance. That's why I can never stop being fascinated by these supreme principles, and I will, to the last day of my career, to share it with my parents. You're never alone. Feng Shui, like they often say, oh, Yin Yang Wu Xing is Feng Shui. No, it's more than that. It's not myths. These are the quantum science. These are the true, the root, the truth of this universe. And the 6 evil pathogens, 7 emotional disturbances, I find it clinically, in my very short clinical experience, emotion is, if not the largest factors. Emotional disturbances would be at least, secondary, but I truly think it's a primary factor. So, in my first exit, I would literally tell my patients probably what your emotions doing to you. There's happiness, anger, worry, pensiveness, fright, fear. They have no idea most of the time. They never think that way. It's so easy. And once you let it out, it's like switch on their certain mysterious button in their brain. They say, oh, a lot of wow and oh in my clinic room. Wow, that's why. Oh, they're related. They're not being dramatic. They're truly benefiting from the principles of TCMs. Yeah. So I've been telling people that, like the food talk, Wendy's, the banana metaphor, excellent. The second role that I view that we have this healer role. Typically within 5 to 10 minutes, I would get through the classical, the 10 questions inquiries. Should be a great 变阴阳. So what is it? So in the initial 5 to 10 minutes, just get, like I said, the 3D image of a patient, their preferences, cold or heat, whether they are the actual volumes of yin and yang within their system. And I would take photos of tongues before treatment and after treatment. Sometimes I forget, but most often than not, I would take the pre and post treatment tongue photos. And the second visit and third visit and everything, I built them into their charts. So I also tell them whenever I take that photo, I would tell them why I've taken this photo and what I detect or decode from those photos. Poses, I'm still learning, and I think it's for poses, it's very personal. It's very individual. One person's normal is another person's abnormal. One person's smooth is another person's wiry. So it's, for me, I always look at that person and I try to feel the emotions in the poses as well while we're talking to them and see the differences. And also before I insert the needles, I would mark down the pose patterns. And during, let's say, needle retention for 15, 20 minutes, I would take it again. And then the post treatment, I would take it once again. So about three times. Lifestyle inquiries, so all of those same things, what we eat. And most of my patients are non-Chinese. So I would start very slowly. I'm not asking them to throw away their cold food right away. I'm not asking them to abandon their fridge. So start slow. I first get the warm water things going and already getting some very good feedback. I with some, like according to their constitution, and some patients come back and say, oh, wow, my digestive tract is so much better. And then they haven't even taken herbs yet. So action and inaction, I often encourage about what they do and what they do not do. Let's say the sleeping pattern, whether there's a particular time they wake up. So all about lifestyle. Treatment protocols. I will have a brief explanation in layman's term to them. What's my analysis and what I view? Maybe you need 3 sessions for this issue, and then after the third session, we're going to move on to a different focus. Or for ICBC, often we get like 12 sessions, 24 sessions, and then how we build that momentum up. Be gentle, be affirmative. That's my style. If they have, I often, for ICBC patients, especially when they first walk in, I would say, okay, what bothers you the most today? So we deal with whatever that's really bothering their mind at the top. So we deal with that. And then we go back to the treatment plan as much as we can. I like this quote, says, 今之医者为之疗人之己而不知疗人之心. Basically is, I try to go a little bit further. And actually from the 10 questions inquiry, a lot of people, you see how they responded to certain questions, let's say bowels, responded to this more like personal and private issues. You understand their personality better. And I try to build it up, and it is not strange. Sometimes patients would, because the space is so safe, they would shed everything. And then that's when the whole can of worms or the whole holistic healing is happening. Yes, I basically touch upon the delivery of messages prior, during, and post. And one thing I would like to touch upon is people massively appreciative towards how I tell them, hey, I'm putting into this point, and this point's name is certain, such and such, and it helps you in such way. And then they truly appreciate it. And then I often find out right at the spot, they will have more chi. They started to feel the chi is circulating and how it stopped in that like swirl around in a certain point and doing that gentle little treatments. So patient practitioner synchronicity is often it's quite common. This is also a very nice quote saying that how we communicate, 告知以其败. So basically, I'm very blunt with my patients. I'm very polite. I've never raised my voices, but I will let them know what my analysis, it's subjective as a practitioner, what led you, what the so-called failure that leads you to today's point. And actually, this thing is blocking me. 以知以其 Hold on. So I also appreciate how the classic teaches us how to do. I just need to get this out. Okay. Yeah. Good. 与之以其善, like I said, attitude is very important. 导之以其变. Sometimes especially for initial visit, some information I'm withholding. So I have to see their how they can, like how much they can take in. 开之以其苦. My understanding is that be mindful about people. They won't be opening up 100%. There are times that they open 100% in the initial visit. There have, but if they don't, we understand it. I put a pause and then I go back when the bonding build up further. 所有无道之人，无有不听者. Here, when we say in the classic, it says 无道之人. We often, when I first read the classic, I was like, oh, 无道之人. So this is like something like scolding. It's like, later on, I just spend more time on it. I just find that it's just the poor general public. Most of them, they don't have the knowledge, they don't have the wisdom to understand the heaven and the earth way, and that's. They call the 无道之人. That's my understanding. So yeah, so if we follow what the inner classic is teaching us how to communicate, I think it's a very open, genuine. So far, I'm enjoying it. And yeah, one more point for my fellow practitioners is that never be arrogant. We are humbled. We are the messengers being handed down with this massive wisdom. Where am I? How about what's my time? We're almost up, right? Yes. Yeah. Yes. Influencer role, I will quickly talk about it. It's how we carry ourselves. This is not language. Language is, again, it's beautiful, but it's part of the flaws in our dualistic earth. And I like to carry things often in a more subtle ways as well, and then let the patients feel that they are being cared for, they're being trusted. So that's when I say influencer role. Beholder of massive wisdoms, I would like to get this out. And fellow new practitioners, don't feel small. When we're first starting out, we feel small, but we shouldn't. When we're first starting out, it's easy to feel isolated, but we're not. So as a torch carrier, well done, keep going. The only catch is the heart-mind ability to revolve. I would love to share this quote because I'm basically taping it on my forehead. 智贤而少欲，心安而不惧，心安而不惧，行劳而不倦. So the will needs to be relaxed. We can't think about, am I, this is billable hours or how much money we're earning. I'm sorry, we just can't be propelled that way because it kind of scale your performance. So relax the will, reduce the desires, calm your heart without fright, because you're doing the right thing. Maintaining an active yet non-exhausted physique. If you're tired, I maintain a little website of mine. I say I work to pull out my best. If I'm not feeling my best, I'm not working. Okay, we're almost to the end. Be a focused generalist. I love this quote saying that the supreme medicine needs to be accurate. Supreme knowledge need to be extensive. So I encourage myself. I'm still doing my schooling, and I don't think I will stop this lifetime. I will just keep learning it. So we have extensive knowledge. However, if we jump to the the skillful, supreme treatment needs to be skillful. So down the road for us, for new practitioners, we sample everything and we narrow it down. There are certain point, I've already found my niche, but I think my niche will continue to evolve, to change. But let's say I learned 10 lineages, I maybe use 1 or 2. Or I would sample, like take the whatever skills that work for me, then I fuse them up and then inject a little bit of personality there. So yeah, basically how many of them? 10 principles. So if we know all of the above 10 principles, then you could say the healer is a sound one. So 医之能释矣. I think this is a great summary. But I'm running out of time. So 以天地为道, to observe the heavenly earth way. 以经典为理法, to find principles and protocols from the classics. 以觉悟为师, believe in your intuition. We've learned so much as a new practitioner. We don't believe in ourselves most. Like when you first get your license, you don't know where to practice. You're like, okay, now I feel clueless. However, we've came this far, and it's time to believe in yourself and use your intuition to find your niche, to find the communication principle that work for you and your patients. Okay, I'm like 4 minutes over. So this is my website, arikahealer.com. Feel free to drop me a line. Thank you. Any questions, especially for my peers? For them. Yeah, thank you.
Thank you for Miss Erica Zhang. We can see she has lots of passionate about TCM. Wonderful speech. Thank you very much.
Thank you so much for your time. Thank you for tolerating my rumblings. I'll stop sharing. How do I? Hold on.
Okay, so our next speaker is Mr. Jiangjun Huang Kim. Are you there?
Yes, I'm here.
Okay.
Can you hear me?
Yeah, I can hear you. But why? Okay, let's see. Erica Zhang? Erica Zhang, are you still there?
I haven't stopped sharing.
Yeah, you haven't. Okay, thank you. Okay, so our next speaker is Mr. Jiangjun Huang Kim. His topic is orthopedic acupuncture and soft tissue release. Yeah, Mr. Jiang, can you introduce yourself a little bit, because there's not more information about you. Okay.
Okay, so wait a second. I'm sharing my So I don't know how to. Hi, my name is John. I'm TCMP, TCM practitioner. I'm practiced for 4 years. I finished Dr. TCM diploma 2019. I'm working at Evergreen Rehab Wellness in Surrey and Belmont Physiotherapy and Health Clinic in Langley. I used to work with other practitioners. like chiropractor and physiotherapists. So yeah, that's it. And then I'm gonna share my, already shared. Did you see my,
No,
the PowerPoint?
no.
Okay. Can I share? Second.
Yes.
Okay, you can see my, yeah. I already mentioned this one. Okay. So I can start right now, right?
Yes, go ahead.
Okay. So what does orthopedic means? So I found some definition. Definition is a branch of medicine concerned with the correction or prevention of deformities, disorders, or injuries of the skeleton and associated structures such as tendons and ligament. So I found the ortho means in Greek is a straight, and then pedic means is pediatric, is children. So I think it's their focus on the straight or correct or rebalance the people with based on their growth. So orthopedic, it can focus on kind of helps their kind of deformities or certain problems. They cannot raise their arm, like, and such as range of motion or strength, weak, something like that. So I thought that it's orthopedic is more very TCM tick, TCM like treatment, because they are talking about the balance or improvement or development. Because we are talking about always balance, emotion and physical, and Jiangfu. So we focus on balance, or also orthopedic focus on balance too. So that's why I always checking the patient when they comes in the treatment room, that how they walk, and then how they stand, how they sit. So hold on a second. Yeah. When they sit, they usually they're cross their leg. Then I kind of think that their pelvis is misaligned, because when I see this one, people cross their leg, right? So they sit on the one side. They put more weight on the one side. So one side is higher, one side lower. So because of that, I think that, already they have some problem in the pelvis. Or, their shoulder is lower, left side is lower, right side higher. So certain balance is not right. So through that, I always checking their posture, that they have some problem. So even walking, sometimes they're limping. They put more weight on the left side. You can see when they're walking in, then they put more weight on one side, where they are more using the evening. So based on that, I can see their kind of balance of the body. So that's why that's very important. Also, when they're standing, they stand just one side more, then, oh, I see, they have some problem. So based on that, I always checking their kind of problem when they comes in or they're waiting for me. So I will talk about the balance, especially posture. I already talked about somebody stand one side, then you can see on the left side, if the put more weight on the right side, then left side is ankle and knee and pelvis and the shoulder all different. So that means if there is something wrong with our ankle, then affects our whole body. And same thing. If they have a problem in the knee, then we can see that they have a problem in other area too. And also they have a pelvic problem. This misalignment then cause their shoulder. Many times I can see that the patient shoulder is lower. Once it's lower, then we can think that it's a shoulder or not only shoulder problem, they also have a problem in other area, in the pelvis or knee or ankle. So this one is a different kind of perspective of the looking. So on the side, if you can see, we can see that it's anterior tilt, left side, and the right side is a posterior tilting. So based on this posture, hip posture, and then pelvic posture, and then shoulder, back posture is different. You can see difference, right? So right side, you can see the posterior tilting position. Their head is a little bit forward. So usually we are saying that head is 10 kilograms. So when you straight, then our whole body observe evenly. But when the head is forward, it's all the weight or pressure is on your cram muscle, on your back, upper back muscle. So based on the posture, upper body, and then some problems that kind of occur in our body. So you can see the sitting posture too. You already saw the picture. And then, so on the right picture, the left side one, it says X. It's not correct, but right side is correct. But I can see right side is incorrect too, because he put more weight on the left hip. You can see, because people usually have a habit to cross their leg. In that case, the right side is up, left side is lower. They put more weight on the left side. So in that case, even though they are sitting, they always have a habit that is put more weight on the left side. So they might kind of, in this situation, many times the patient have a pain on the left hip. So I already mentioned that when they have a pain in one side, they put more weight on other side. So you can see them while they are standing and walking or sitting. So actually, I learned from Dr. Anthony Lombardi. He mentioned that when they get injured in the ankle or knee or glute, it affects their muscle strength in the gluteus muscles, which stabilize their pelvis, and it affects their sitting, standing, or walking. It is the same in the upper body, and injury affects their shoulder strength and range of motion too. So in his book, he explained everything with anatomical term, but I just make it simple. So we can see the shoulder area range of motion of the shoulder related to strength and mobility. You can just check, and then you can Google in the website. So we can check basic one. So flexion is up, extension is lower and then back, abduction on the side up, adduction is down. So for this movement, we have to use our certain muscles. So when you raise your arm 0 to 15 degrees, we usually use supraspinatus here. So after 15 degrees, you have to use deltoid muscle here. So this one is a rotator cuff muscle. This one is stabilize our shoulder whenever you use. Just before I treated one patient, he had a pain on the shoulder and here, the front area, whenever he used the bench press or some push-up. And then after that, next day, he had so much pain. He got an injury before here, dislocation, and also a car accident. So based on the Anthony Lombardi's the theory, then he has the weak muscle for the rotator cuff. So I checked everything: supraspinatus, subscapularis, infraspinatus, and teres minor, all weak. But he didn't know he had a weak muscle. So I have a certain kind of method that I check if the certain muscle is weak or not. It's from the Anthony Lombardi's the books and his lecture. So I'm using his method. Through that, I found out that he has some problem. Then I can treat the certain muscles. So you can see these muscles are for the rotator cuff. So many times people talk about a lot of muscles. I'm not really good at the anatomy terms. So whenever I hear that it's all the anatomical term, then I have a brain kind of spasm. So that's why I like the simple one. So based on that, I found out 4 muscles who related to the rotator cuff is the most important for the shoulder movement or shoulder strength. So you can remember this one. If you want to do orthopedic or kind of muscle-related kind of acupuncture and treatment, then you can start with these 4 muscles for the upper body, especially shoulder. So one is a supraspinatus. I already shared that these muscles can help raise 0 to 15 degrees. The other one is subscapularis. This one is for the internal rotation. And then the other one, infraspinatus and teres minor, is for the external rotation. But these 4 muscles always using for our shoulder movement. You can see teres minor muscle. This one is all muscles. Rotator cuff muscles always connected to the head of the humerus. So that's why it's stabilized our shoulder movement. You can see this one. These muscles. Yeah, this one is a serratus anterior. Underneath your armpit area. Then many times people have so much pain here when you touch it, but without touching it, mostly they don't realize they have a pain. Usually they come to see me because they have a pain on the upper shoulder, the trapezius muscle or neck muscle pain, or they have the shoulder mobility limitation. They cannot raise their arm. They cannot touch other side of their shoulder. In the case, they usually come to see me to get a treatment. But many times they have so much pain in this area. So I'm going to talk about the muscle testing for that. So I usually testing 4 muscle for the rotator cuffs. It's number 2 is a supraspinatus. I already mentioned it. Number 3 is infraspinatus and teres minor. This one for the external rotation. Number 4, subscapularis. This one for the internal rotation. Number 5, serratus anterior. This one is kind of when you raise your arm, serratus anterior muscle is a kind of holding and the supporting. So, and then deltoid. Number 1 is deltoid muscle. When you raise your arm from 15 to 90 degrees, you have to use these muscles. So these all muscles are working together. So based on this muscle testing, I'm treating. I know where I have to treat. So you can see that deltoid muscle, first one anterior, in the middle, and then the posterior deltoid. So this one is checking the muscle testing for deltoid. So I usually say push up and then hold the elbow area to feel the resistance. So if they have a problem, their shoulder dropped right away, or shaking, or they have a pain in certain area or the deltoid area, then I can see, oh, he has some problem in the deltoid. So actually, these pictures about the testing of anterior deltoid. So medial deltoid is like this one is a posterior deltoid, the anterior deltoid. This one middle deltoid, and the posterior deltoid is a push back movement is a posterior deltoid. So through this, I kind of find out that which deltoid is weak, which deltoid is a problem. So the other one is supraspinatus. We usually empty cup. We are saying the empty cup and then lower like this. And then I usually say push up. Then I can feel the resistance. Then if they have a weak, then they have a problem in the supraspinatus, which is a very important muscle to raise their arm 0 to 15 degrees. Why this one is very important? Because once our car broken, then we have to push to move, right? In the beginning, it's very hard to move. So that's why a couple of people have to move together because we have to use more strength. After moving it, it's easy to move. So actually, supraspinatus is the muscle that move in the beginning. So this muscle has to have a strong strength to move. Otherwise, doesn't move at all your body, your shoulder. So supraspinatus is using that kind of the movement. So I usually checking this one and the left side checking first and then right side. So usually check the normal side first and then the later is checking the painful kind of shoulder area I'm checking. The other one is serratus anterior. This one is lift your arm and then push, kind of saying that it's a push up and then I'm holding like this. So through that, I know that he has a problem here, the muscle, who can support or not. So infraspinatus and teres minor is, I usually say is rotate outside. So I told that this muscle is about the external rotation. So holding it outside and then say push out. then you can feel it. Is it strong or not? So you can check the both side. Then one side is always weaker than other side. So this one is different, right? I put the outside of the arm. This one is inside their arm, right? So this one is for the subscapularis. For the subscapulary test, I put my hand to the inside that they can, I usually say, push in. Then we can feel it, that weak or stronger. So based on that, we can check which muscle they have a pain, or they have some the muscle strength problem. So many times, my patient who came to see me first time, they didn't know that acupuncture can help them to improve their mobility and also strength. They think that just we can help their pain relief, but no, we can help their muscle strength and also their mobility very easily. So these days we are kind of write the report, extension report of the ICBC cases. So they ask a lot of questions about that. Acupuncture, if acupuncture can help their mobility or their strength. So whenever I write down this kind of thing, they always email back to me, then how can the acupuncture can help? So I explain everything and found some studies and from my experience too. So make it short, acupuncture can help to improve their mobility and strength too. So when they have a problem, I acupuncture with electrostimulation. But I tried the acupuncture without stimulation, still working. So, but if we want to check their muscle, they shouldn't have a pain, because when they get tested, they have so much pain. How can I test, right? So I use a mirroring kind of technique. So like I learned some master tongues or balance method, but basically mirroring, very simple mirroring. So if they have a pain on the shoulder, I need the exact other side, and then checking the shoulder. Then usually the pain is gone a lot of time. Then I can check after that. So it's pain relief is a first a priority to remove to do, because for the muscle testing, they have to have less pain. So after release their pain, I check their muscle, like supraspinatus, and then serratus anterior, teres, and the infraspinatus. There are 4 muscles for the rotator cuff, which, if their muscles affect their the situation or problems or not. So many times, these rotator cuff muscles related their kind of problems. So I already checked the muscle strength, then release. So needle for the serratus anterior. Usually I needle from the side, the direction to the like this, or some other side too. But usually needle this side to target the serratus anterior. That one is pretty deep, so you shouldn't needle perpendicular like this. You have to needle here. Then many times you can reach the serratus anterior And also that serratus anterior many times connect your latissimus muscle together. Then when you stimulate with the electrostimulation, then you can release your serratus anterior or the latissimus muscles too. So once you get a recover, always right after the acupuncture treatment, I'm checking if their muscle strength is recovered or not. Most of the time, their muscle strength is already recovered, but they cannot use 100% right away. I always recommend them to reduce intensity of their exercise 50% or 25%. So yes, they can exercise right after treatment, but they have to reduce the intensity or weight. If they use 100 kilograms, they have to use, after treatment, they have to use 50 kilograms of the weight. So today, I told you I had a patient who had a pain here after exercising. I told him that reduce the intensity or weight 50%, and then gradually increase the weight and or intensity every day, 5% or 10% every day. So check it out and then come next week, how it works. So yeah, based on the that one, I treat them. Also, I'm treating their mobility. So sometimes, even though they have the strength recover, their mobility is very limited. Then I use the local point, arch point, or muscle trigger point, or motor point, and mirroring all together that improve their shoulder mobility. But many times I use Sanjiao 3 can help their shoulder flexion and also neck rotation same time. So when they have a shoulder range of motion is very limited, I always use other side of the Sanjiao 3. Then right away they can raise their arm pretty much normally. Then I can check their muscle. So through this kind of treatment, I usually treat them. So if I have time, then I can share what the motor point is. But today I'm gonna finish with this, and I just wanna make sure that acupuncture can help that improve their strength and then mobility, and also the soft tissue release. We can say is a tweener, right? Tweener can help. So many times I kind of, do you see the body, right? So this one is serratus anterior. When you massage here and then moving a little bit like this, holding it here, then moving like this, and then helps to release. Always using the active release technique, holding and a massage or press certain area, then moving it. Then many times muscle strength recover, but it doesn't last forever. Doesn't last longer than the acupuncture, but still this one is working. So after 3 to 6 weeks of the injury, we have an adaptation. Our body changed because we have a pain, so much pain, and the certain muscle is limited, certain mobility is limited. That's why our body have an adaptation. In the case, we have to deal with their soft tissue too. We call the myofascia, right? So always after 3 or 6 weeks of the injury, if we have a patient who has an injury over 3 to 6 weeks, are always using my tweener technique. So active release technique here, and then using this point teres is a SI9 area. Then you can just push it. Then you can feel it, or patient knows it's a very painful area. Then you can release, same times moving their shoulder. Then usually our muscle strength will recover, and then their shoulder mobility is recover too. Many times, somebody who's afraid of the needle, then I use this area to massage soleus anterior and ramus all together, kind of here, using like this and moving. Then right after that, their shoulder mobility is way better. So based on this, we can use the treatment for the muscle strength and then the mobility of their shoulder. So I just want to finish. Yeah, today I prepare this much. Thank you for listening.
Okay, thank you, Mr. John. Give us lots of information about the muscles and share his knowledge. Thank you very much.
Yeah, thank you.
Okay, so that's all the speech for today. Thanks the all speakers to give us the lecture. A very wonderful and great speech. And we also have another 2 days lecture. So please join us again. And thank you everyone for watching today's session. Have a good night. Bye-bye.